How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a battling stone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
The work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.
Good afternoon. Can I remind members that social distancing measures are in place in the Chamber and across the Holyrood campus, and I ask that members take care to observe these measures, including when entering and exiting the Chamber, and please only use the aisles and walkways to access your seat and when moving around the Chamber. The first item of business this afternoon is time for reflection, and our time for reflection leader today is Reverend Canon David Richards, the Rector of St Paul's and St George's Church in Edinburgh.
Thank you, Presiding Officer.
When white Europeans arrived on the island of Hawaii, the locals called them Haole, H-A-O-L-E. It literally means no breath. One indigenous Hawaiian explained it like this. The settlers, they said, were always in a hurry to build plantations, harbours and ranches. They always seemed out of breath. I have a question for you this afternoon. What patterns or rhythms of life do you have that renew and sustain you, that give you the chance to draw breath? It's been said that the hardest person you will ever lead is probably yourself. Former UK chair of the International Stress Management Association observed this about the person of Jesus Christ. Jesus taught and practiced self-awareness. Jesus responded rather than reacted to whatever happened. His ability to respond, his response ability, was strong. And it is fascinating to see how Jesus sustained his life. He didn't spend all his time praying or reading the scriptures. He didn't spend all his time alone in quiet and solitude or performing miracles or preaching. He did those things, but he did other things as well. He had a group of really close friends that he spent time with and laughed with. He regularly went to corporate worship, went to the synagogue and the temple. Imagine being the Son of God and having to listen to other people's sermons. He enjoyed creation, long walks and exercise. He welcomed small children and listened to them. He enjoyed meals and parties, especially with non-religious people. If we don't tend our souls, then we end up with what one psychologist has called ego depletion, a level of fatigue that goes beyond mere physical tiredness. Depleted people will feel sad more easily and are more likely to make poor choices. Physiologically, an area of our brain, the anterior cingulate cortex, actually experiences slowing down. How do you know if your soul is weary? Well, small things irritate you more than usual. You find it more difficult to make decisions. The temptation to eat more, drink more alcohol, or to give in to particular cravings is harder to resist. Simply, you have less courage. There's a famous quote, "Fatigue makes cowards of us all." The people of Scotland need you to be healthy, to have patterns of life that sustain and renew you, so you can make good, brave decisions and be the leaders we need you to be. A Sabbath, whenever you might practice it, is a time to transition, it's been said, from human doings, human beings. My prayer for you is that you find that rhythm of life, a rhythm that gives you chance for breath and to find rest for your souls.
Thank you. Thank you very much. The next item of business is a statement by Nicola Sturgeon on COVID-19 update. The First Minister will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on Nicola Sturgeon.
Thank you, Presiding Officer. In this statement, I will update Parliament on the Scottish Government's assessment of the course of the pandemic now and on the decisions that flow from that in relation to the levels of protection that will apply to each local authority area from Saturday. In addition, I indicated at the end of last week that I would give an update on the situation in Glasgow by no later than Wednesday, and I can confirm that I'll also do that today. However, before any of that, I'll report on today's statistics. The total number of positive cases reported yesterday was 478, which is 3.1% of the total number of tests conducted. The total number of confirmed cases, therefore, is now 236,389. 106 people are currently in hospital, which is 4 fewer than yesterday, and 10 people are receiving intensive care. That is 2 more than yesterday. I'm also relieved to say that no deaths were reported yesterday, and that means the total number of deaths registered under the daily definition remains at 7,669. But again, I want to convey my condolences to everyone who has lost a loved one. I'll also give an update on the vaccination programme. As of 7:30 this morning, 3,267,290 people had received their first dose of the vaccine. That is around 72% of the adult population, and it represents an increase of 16,152 since yesterday. In addition, 30,978 people received a second dose yesterday, and that brings the total number of second doses now to 2,075,231, and that represents, the total number represents around 46% of the adult population. Presiding Officer, the decisions we have arrived at today are difficult and complex ones, and this reflects the fact that we are currently at a delicate and fragile point in what we very much hope is a transition to a different way of dealing with this virus. In summary, we do believe that vaccinations are opening the path to a less restrictive way of dealing with COVID, one that is less driven by case numbers. But because not all adults have been fully vaccinated with 2 doses to date, we are not quite there yet. And as we make this transition, just to compound the challenge further, we're also dealing with a new, faster spreading variant. This is, of course, a new development that has arisen since we set out our indicative route map back in March. All of this means that at this critical stage, to avoid being knocked off course completely, we must still err on the side of caution. And I'll share more detail of all of this now. The considerable downside that we face just now is the Indian or April 02 variant, which was renamed last night by the World Health Organization as Delta. This variant is spreading faster than previous variants of the virus, and we now believe that it accounts for well over half of our new daily cases. Because of that, Scotland's R number is almost certainly above 1 right now. And as we know from past painful experience, that makes our situation highly precarious. Indeed, many public health experts are warning that the UK could, and I stress could, now be at the start of a third wave of the virus. And obviously, it would be wrong to completely ignore that warning. However, and this is the considerable upside, we now have a significant advantage that we did not have in the first or the second wave. We are increasingly confident that the vaccines are effective, though we're closely monitoring the vaccination status of people admitted to hospital. But we do now have evidence that the link between cases and serious illness, hospitalisation and deaths does appear to be weakening. For example, since January in Scotland, the proportion of new cases which lead to hospital admission has reduced on current estimates from 10% to 5%, although it is important to say that we're still assessing the recent impact of the new variant. In addition, the length of time people are spending in hospital has also been reducing quite markedly since the new year, though again we are monitoring this data closely and carefully. So the emerging evidence is providing us with a firm basis to believe that in this next coming phase of the pandemic, we will be able to deal with the virus differently and less restrictively. However, and this is why I have described our current situation as a transition, although we are vaccinating as quickly as possible and trying to speed up as much as possible, there is still a sizable proportion of the population not yet fully vaccinated. And full vaccination is vital. Protection against the Delta variant after 1 dose is not negligible, but it is not substantial either. It is after 2 doses that the protection becomes much stronger. So if cases continue to rise significantly for too long a period of time, while significant numbers are not fully vaccinated, we could still see a significant burden of illness and death and severe pressure on our NHS. And it might also be worth just pausing to reflect at this stage on what protecting the NHS, which has been a key aim throughout this pandemic, means in the current context. After coping with the pandemic for more than a year, the NHS is now seeking to get non-COVID treatment back on track. That means protecting the NHS can't just be about preventing it from being completely overwhelmed, although that is of course vital. It must also be about protecting its ability to get services back to normal. So even although the health service coped earlier this year when more than 2,000 people were in hospital, albeit, I should say, with enormous pressure on the workforce, that shouldn't be our benchmark. Anything remotely like that again would set back our efforts to get the NHS operating normally again. So this is a key and a difficult moment. We do remain on the right track overall. I remain confident that with cautious, albeit difficult decisions now, we will enjoy much greater normality over the summer and beyond. None of our decisions today, even in the face of rising case numbers, take us backwards. And while I know it's hard to think in these terms more than a year into a pandemic, that does represent real progress from the start of this year. Back then, remember, a new variant and rising case numbers did take us backwards into a full lockdown. That is not the case now, and because of the vaccination programme, we can still look ahead with confidence. But, and this is the difficult part, in areas where cases are relatively high or rising, our judgment is that a slight slowing down of the easing of restrictions to allow time for more people to be fully vaccinated will help protect that progress overall. And that leads me to the decisions that we are setting out today. Now, it's important to recognise that the picture across the country is not uniform, and so our decisions are not uniform either. That is the benefit of the level system. We don't need to apply a one-size-fits-all approach with the same levels of restrictions in areas with low or more contained case numbers as we do in areas with high or rising numbers. However, a variable system also has its downsides. It is more complex, it is impossible to remove every anomaly, it's not without risk, and of course it can lead to a sense of inequity. That is why it is important to set out as clearly as possible why different areas are subject to different restrictions, while recognising that these decisions are complex. So let me turn to those decisions, and given that it has been in a unique situation for the past couple of weeks, I will talk about Glasgow first and separately. I reported on Friday that the situation in Glasgow appeared to be stabilising, and I'm pleased to say that this remains the case. Indeed, case numbers have fallen slightly in recent days from 146 cases per 100,000 people to 129. And this provides further evidence that the major public health interventions we've seen in the past few weeks are having an impact. In addition, although hospital admissions are rising, the vaccination effect means that they are not, at least at this stage, increasing as fast as they might have done from a similar level of cases earlier in the year. It's also important, of course, that we consider the harms caused by the virus alongside the other harms that ongoing restrictions cause. These include wider health harms, social harms and economic harms. And these wider harms are not insignificant in Glasgow, given that it is now more than 8 months since, for example, we were last allowed to visit each other in our homes. So taking all of this into account, and with the support of the National Incident Management Team, I can confirm that Glasgow City will move down to level 2 from midnight on Friday into Saturday. This means that people in Glasgow, as has been the case in most of the rest of Scotland since mid-May, will be able to meet in homes in groups of no more than 6 from a maximum of 3 households. It also means that indoor licensed hospitality can reopen and that people can travel again between Glasgow and other parts of Scotland. A number of venues will also be permitted to reopen, and outdoor adult contact sports can resume. These changes are significant. As someone who lives in Glasgow, I know they will make a huge difference to quality of life. But I ask everyone to remember that, although stable and starting to decline, cases in Glasgow do still remain high. So please continue to be cautious. In particular, and this actually applies to all of Scotland, particularly while we enjoy some better weather, although limited indoor meetings are now possible, it is still better to stay outdoors where possible. And in level 2, groups of up to 8 people from 8 households can gather outdoors. The last 8 months, and perhaps the last couple of weeks in particular, have been really tough for Glasgow, so I want to thank everyone who has cooperated with all the public health measures and stuck to all of the rules and guidelines. I'll now turn to other parts of the country, and I'm going to first set out the difficult part of this statement. There are a number of other local authority areas, in addition to Glasgow, that are not currently meeting the criteria for level 1, either in case numbers or test positivity. Indeed, if we looked at just the raw numbers, it could be argued that some of these areas should be in level 3. However, our judgment, based on the emerging evidence of the impact of vaccines that I spoke about a moment ago on hospitalisation, and our assessment of local factors and public health interventions, is that level 3 would not be proportionate at this stage. However, it is also our judgment that with case numbers as high as they are in these areas, and with a substantial proportion of adults not yet double-dosed, it is safer and more likely to protect our progress overall if we hold these areas in level 2 for a further period. In addition to Glasgow, this applies to Edinburgh and Midlothian, Dundee, East Dunbartonshire, Renfrewshire and East Renfrewshire, the 3 Ayrshires, North and South Lanarkshire and Clackmannanshire and Stirling. Now, I know this will be disappointing, very disappointing for people in these areas. For these local authority areas, I should say we will be providing support to soft play and other closed sectors that had expected to open or operate in a different way from 7th June, and full details will be provided by the Finance Secretary tomorrow. But it is important to stress that this is a pause, not a step backwards. And level 2 is not lockdown. It does have an impact on opening hours of pubs and restaurants and the numbers that can attend certain events. But we can still meet indoors in limited numbers and outdoors in groups of 8 from 8 households. Hospitality remains open, indoors and outdoors, so does retail, and there are no travel restrictions in place. And taking a cautious approach now, where more people get fully vaccinated, does give us the best chance of staying on the right track overall. So to everyone in these areas, please continue to be careful, follow all of the important guidance on hygiene, distancing and face coverings, keep getting tested and come forward to be vaccinated as soon as you get the opportunity. In more positive news, there are many parts of mainland Scotland where cases are at very low levels and broadly stable, or where case numbers might appear to be rising, but we are assured that they relate to clusters that are being managed. So I can confirm that the following areas will move to level 1 from 1 minute past midnight on Saturday morning. Those areas are Highland, Argyll and Bute, Aberdeen City and Aberdeenshire, Murray, Angus, Perth and Kinross, Falkirk, Fife, Inverclyde, East and West Lothian, West Dunbartonshire, Dumfries and Galloway and the Borders. The full detail of what that means are set out on the Scottish Government website, but the main changes are as follows. The limits on meetings in indoor public places increase to 8 people from 3 households and outdoors to 12 people from 12 households. 100 people as opposed to 50 can attend weddings and funerals, and places like soft play and fun fairs can reopen. Again, I know these changes will be welcome, but please continue to be careful. That applies to all of us right now, and in particular it applies that meeting outdoors involves much less risk than meeting indoors. Finally, Shetland, Orkney and the Western Isles and a number of small remote islands are already in level 1. These communities are continuing to report extremely low numbers of new cases, and in many cases a higher than average proportion of adults have received both doses of the vaccine. So these areas will move to level 0, again from a minute past midnight on Saturday morning. Full details of what those changes mean can also be found on our website, but for example it means that people can meet indoors in groups of up to 4 households. Local licensing laws apply in hospitality. There's no set nationwide closing time, and it means that the maximum attendance at weddings and funerals will be 200 rather than 100 at level 1 and 50 at level 2. Again, though, as well as asking islanders to exercise continued care, I would remind anyone travelling to any of the islands to use a lateral flow test before doing so. That way you will minimise the risk of taking the virus to any of these communities. Presiding Officer, I appreciate that today's decisions will feel like, and indeed are, a mixed bag. That reflects the fact that we are in a transition phase. The vaccines do make the outlook positive, but the new variant means that the road ahead is still potentially bumpy. So caution is necessary. That said, no part of the country is going backwards today. Before the vaccines, that would have been impossible on case numbers like these. But the vaccines are changing the game, and that means we can still be optimistic, very optimistic, about our chances of much more normality over this summer and beyond. Indeed, in the days ahead, and while it might still feel a way off for many of us, we will publish more detailed work on what we expect life beyond level 0 to look like as that greater normality hopefully returns. Indeed, one reason for proceeding with more caution now is to make it easier in future to resume that progress to level 0 and then beyond. My last point, and this is the one I will finish on, is that, as always, all of us have a part to play in beating the virus back. So please get tested regularly. Free lateral flow tests are available through the NHS Inform website. I would encourage again everyone to order these and test yourself twice a week. The lateral flow tests give results in about half an hour, so they're a very quick and useful way of finding out if you might have the virus, even if you don't have any symptoms. Essentially, the more we all get tested, the more cases we find and the more we break chains of transmission. So getting tested regularly is a way for all of us to contribute to the collective effort. And secondly, make sure you get vaccinated when you're invited to do so. That includes going for second doses. To repeat what I said earlier, second doses are vital in providing substantial protection against the virus and in particular this new variant of it. If you can't make an appointment, and there will often be good reasons why that's the case, then please make sure you rearrange it. If you haven't received an appointment letter yet and think you should have, you can go to the vaccinations page of the NHS Inform website to arrange your appointment. Getting vaccinated is in all of our own best interests. Whatever age we are, it makes it much less likely that we will become badly ill from COVID. But it's also part of our wider civic duty to each other. It means that all of us can help suppress the virus and reduce the harm that it causes. And that will allow us to get to that phase of being able to deal with this in a less restrictive way than has been the case. And finally, I would ask everybody to please continue to stick to the rules where you live and follow the public health advice. Physical distancing, hand washing, face coverings, all of this is still important for now. These basic precautions will reduce our chances of getting or spreading the virus. So in summary, please get tested regularly, get vaccinated when you're asked and continue to follow the public health advice. If we all do that, then despite a pause for part of the country today, we can keep on the right track and we can then make progress over the summer to living much less restricted lives. So let me end by thanking again everyone across the country for helping us do exactly that.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business. It would be helpful if members who wish to ask a question were to press their request to speak buttons now. And I call on Douglas Ross.
Thank you, Presiding Officer. I had hoped to say that today's statement is, at least broadly, a move in the right direction. And for the people of Glasgow, the move to level 2 from Saturday will be a most welcome step to bring to an end 277 days of our largest city living under some of the toughest restrictions. But for people all over the country, in 14 of the 32 local council areas, today's statement is a disappointing setback. Half of the country will move forward, while the rest remain stuck in limbo, with no clear idea of when the restrictions will ease. We understand the need for caution, but we also believe more emphasis needs to be placed on the impact of these restrictions on businesses, on jobs, and on people's mental and physical health. We believe a more local approach is necessary, with targeted interventions to tackle local outbreaks instead of sweeping measures. The approach of council-wide restrictions is now out of date. It was designed before we had an effective, successful vaccination scheme. The First Minister herself said in her statement 72% of adults in Scotland have now had the first dose of the vaccine, and 46% of adults in Scotland are now protected with both doses of the vaccine. The First Minister also said today that we don't need to apply a one-size-fits-all approach, but it seems that's exactly what's happening. Keeping whole councils or cities in level 2 is not targeted. It's not a local approach. So let me ask the First Minister, will she consider moving to an approach of targeted interventions instead of council-wide restrictions? I'm sorry that some SNP members feel the need to heckle, but we have had 20 minutes of a statement from the First Minister on an extremely important issue for our country, and it's now appropriate, we don't get this on the BBC, I know, it's now appropriate for opposition politicians to question the government. That is healthy in a democracy. So could I also ask the First Minister, what plans are in place to speed up vaccinations for areas with local outbreaks beyond the measures already set out? What further support can businesses expect? While the Finance Secretary will update Parliament tomorrow, has the First Minister looked into the issues that I raised last week from the Glasgow Chambers of Commerce, for example, that said funding promised has not been delivered to businesses? Can the First Minister inform the public what evidence there is of an imminent severe pressure on the NHS, as she outlined in her statement? And finally, how will the Government ensure public compliance with the restrictions that have been set out when, after more than a year of their lives being upheaval in their lives over the last year, and with hospitalisations at such a low rate, people really are at the end of their tether?
First Minister.
Well, I think the first thing I would say, Presiding Officer, is whether people in this chamber, or indeed across the country, agree or disagree with the decisions I'm taking, and it's perfectly legitimate to question them and indeed to disagree with them. I hope everyone will accept that I don't take, and the Government doesn't take, any of these decisions lightly. I absolutely long for the day that I can stand here and say no more restrictions are required anywhere in Scotland. There is no part of me that wants to hold us back from that for a single second longer than is necessary. But it is really important at this juncture, if we are to keep our progress moving overall in the right direction, that we are cautious and careful. I've been criticised, and again, it is perfectly legitimate for people to do so, for erring on the side of caution at various points over the past 14 months or so. And I don't pretend that the decisions I or the Government have taken have been perfect, far from it. But every time we have erred on the side of caution, I think time has told that that was the correct or necessary thing to have done, and it's important that we do so now. We're not taking a one-size-fits-all. If we were taking a pure public health approach to this, and indeed there will be some public health voices who might prefer that this is what we are doing today, we would simply have held the whole of the country in the levels they are at right now. On some of the raw figures, it can be argued, or could be argued, that some areas should be at a higher level. We are taking all of the different factors into account, not least the progress with vaccination. If I can give just one example to illustrate that point. In Highland, you look at case numbers in Highland right now, and they look as if they are going in the wrong direction quite fast. But we know that there is a particular issue, particularly around the Fort William area. We know it's being managed, so we are not applying higher restrictions to Highland overall. We're allowing the public health interventions to do their work, just as we did in Clackmannanshire and in East Renfrewshire in the last few weeks. So we are taking a targeted approach, but we also have to recognise travel patterns and the interactions between different areas. This is not perfect. It's not ideal, but we are taking the most proportionate and balanced approach that we can. Just briefly to refer to some of the other points, you don't have to go very far to hear public health experts warning against a lack of caution right now, but also pointing to the fact that while the vaccination is proving to be effective, all of the news on vaccination is good, but we still have around 50, slightly more than 50% of the adult population that haven't had both doses. And while that is the case, we remain vulnerable to this new, faster spreading variant. That's why we need to be cautious. Vaccinations are speeding up. Again, just for example, today we've reported just under 31,000 second doses. Yesterday that was 21,500. So we are speeding up on vaccination and continue to do that and to make it more flexible as well. I did not say the health service was at imminent risk of severe pressure. What I said was, and this again is based on public health advice, is if we don't act with caution, it is possible that from that unvaccinated, or rather not fully vaccinated pool, we would still start to see hospital numbers go up. And the other key point I made is that while earlier this year the NHS coped at 2,000 COVID patients at peak, we don't want to get back to anything like that, because that means the health service virtually can't do anything else. We're trying to get the health service back to normal. Presiding Officer, I'm sure I've missed some of the points here. I will end with this. I do not want to keep a single part of this country in tougher restrictions or any restrictions for longer than necessary. But I do have a duty to continue to navigate us through this safely, where necessary, cautiously, so that we can keep our progress on overall. And the very last point in response to Douglas Ross, level 2 is still tough. I don't pretend otherwise. It is not lockdown, though, and we don't do anybody any favours by suggesting it is. We can go into each other's homes. We can see hospitality open, stay open indoors. So there are significant steps forward there that are important for businesses and for the mental and physical health of the population.
I call Anna Sarwar. Presiding Officer, this is largely welcome news for people in Glasgow and many across the country, but I know for many in those parts of Scotland that were expected to move down a level, this news will come as a bitter blow. I want to focus on our response in the hotspot areas, and it is paramount that we now design proper protocols for what happens in current and future hotspot areas, learning from the Glasgow experience. Those protocols must include walk-in vaccination centres for everyone aged over 18, the mass rollout of PCR tests, increased support for local businesses and greater access to isolation support grants. That must be our first point of call in future outbreaks, not further lockdowns which damage the economy and have a negative effect on people's mental health and well-being. Glasgow has been a hotspot area for now almost 3 weeks, but it remains the second lowest level of vaccine uptake of any local authority across the country, and we still don't have walk-in vaccination centres for people aged over 18 and above. At the same time, we are hearing daily stories about unattended appointments and large-scale unattended appointments. So what urgent investigations have the government done? What steps are being taken to address these large-scale missed appointments? And what urgent action has been taken to make sure we can increase the performance of vaccine uptake in those hotspot areas? When will we have walk-in vaccination clinics for people aged 18 and over in hotspot areas? And will the First Minister commit to publish hotspot protocols for future outbreaks?
First Minister.
These are all perfectly reasonable and legitimate points. If I can run through them, hopefully more briefly than I did in my previous answer, Presiding Officer, one by one. Over the past few days, I've heard people not surprisingly say, in relation to Glasgow, why aren't we going door to door with testing? Why don't we have drop-in vaccination clinics? Why don't we have surge tests? All of that was happening in Glasgow and has been happening in Glasgow over the past couple of weeks. And that is why we believe we're seeing the situation in Glasgow not continue with exponential rise, but stabilise and now start to decline. So the lessons in Glasgow are important, and it's important that they can be applied and are applied elsewhere. So I'm going to use a different word just because it's the one we're using in government. There is a toolkit being prepared that is taking the lessons and the learning from Glasgow and making that available to all other health boards. The Health Secretary is meeting with all Health Board Chief Executives tomorrow to talk about the importance of that as well as the wider issue. I certainly, I'm sure it is very technical in many respects, but I'm certainly more than happy to look at how we publish something that is available to the public to know what should be expected. Not when hotspot areas become hotspot areas, but when there is any emerging evidence that that is the direction of travel. In terms of vaccination, there's a couple of things that I know people do understand in vaccination. We need to, firstly, make sure we have the supplies to do everything. Supply continues to be our biggest constraint, but it's even more complicated than that because we have different vaccines and they can be used differently for different age groups. So in terms of Pfizer, for example, which is being used for the younger age groups, that is where supply is tighter than it is with AstraZeneca. So we've got to balance all of that. And secondly, but most importantly, we know that the most vital thing we do. Getting over 18s with their first dose is important, and appointments have already started in Glasgow with that, and we will look, as supplies allow, at having drop-in clinics. But getting people who've had their first dose with their second dose is what increases substantially the level of protection from the vaccine. So that's why over the next few weeks, there will deliberately be an emphasis on completing second doses. So all of this is important. All of this is work that is underway, and we continue every single day to do what we can. Back at the start of the year, I wasn't the only one that did this, but used the terminology of the race, the vaccine against the virus. We're going as fast as we can with the vaccine, and we've got to continue to look for ways to speed up. Unfortunately, though, the virus keeps learning to run faster. And that is the big challenge that we're up against right now. And that is what makes these decisions still as difficult as they are.
I call Lorna Slater to be followed by Willie Rennie.
The First Minister is aware just how challenging the pandemic has been on household budgets. Many people have spent much of the last year on the furlough scheme, earning 80% of what might have been an already low wage. Others have lost their jobs completely, with little hope of finding another. The eviction ban has been a lifeline for people, but that protection has been swept away, and many face eviction now if they can't cover their rent. The job prospects of a recovery just aren't there yet. Will the First Minister give urgent consideration to reinstating the eviction ban across the whole country for as long as COVID restrictions remain in place?
First Minister.
Yes, we will keep all of these things under consideration. The ban on evictions, of course, was extended for level 4 and level 3 areas, but of course, as of Saturday, no part of Scotland will be in level 3, so we need to continue to consider the nature of our response. I don't underestimate, because we have extended it on more than one occasion now, I think, the importance of the eviction ban, but it's also important that we do as much as we can to help people with the causes of rent arrears and to help them deal with those rent arrears. So, for example, the loan fund that we set up to help people who are having difficulty paying their rent is important as well, getting more money into people's pockets through help for low-income families. So this needs to be a package of measures, and we will continue to keep that under ongoing review.
Willie Rennie, to be followed by Elena Witham.
Whilst the limited easing is positive for many, I'm concerned, deeply concerned, about the lack of services for adults with special needs. After a year, it's certainly taken its toll on them. One family told me, "We feel completely let down and abandoned." Does the First Minister agree that if we can open up pubs and football fan zones, we should be restarting community services for adults with special needs?
First Minister.
I firstly absolutely recognise how difficult this has been for everybody, but particularly for people who already were vulnerable, and adults with special needs are definitely in that category. And again, I would, and I know Willie Rennie does, ask people to, as far as possible in a really difficult circumstance, take in good faith that we're trying to manage these issues as carefully and as sensitively as we can, with safety absolutely paramount. I do think now we are in a phase where more of services that Willie Rennie is talking about get back to normal. I understand why people compare events with services like this. Often there are very different issues at play, and it can be an oversimplification to do that, although I understand why people do. We want to get all of the services that are most important for people back as quickly as possible. And if I can widen the point slightly to the NHS, it's why I don't think we should just be complacent about saying, well, we've only got 100 in hospital today, we know the health service can cope with 2,000. We don't want to get anywhere near that, because that means we have to pull back again on non-COVID services. So some of this caution today is about trying to open up as much of the normal service provision across the piece as we possibly can. And I give an assurance that adults with learning disabilities, that for groups with vulnerabilities, they remain absolutely at the top of our list of priorities.
Elena Whittam, to be followed by Miles Briggs.
Thank you, Presiding Officer. To ask the First Minister if the Scottish Government has assessed the impact COVID-19 and the resultant isolation has had on those with mobility issues, and whether more physiotherapy services are needed, particularly for our elderly citizens and those with disabilities, to stop possible early and preventable admittance to care home settings.
First Minister.
Thank you very much. I think this is the first opportunity I've had to formally welcome Elena Whittam to Parliament. It's good to see her here. The COVID pandemic has, as I was just reflecting on to Willie Rennie, it's had an effect on everyone, but on everyone in different ways. That undoubtedly includes the impact of decreased activity on mobility and independence. The rehabilitation framework highlights the importance of access to rehabilitation and self-management for everyone, and that includes access to specific services like physiotherapy, but also the importance of supported activities in a local community and supported self-management across the health and care system. So again, these areas remain priorities for us to support and get back to normal as quickly as possible.
Miles Briggs, to be followed by Christine Graham.
Thank you, Presiding Officer. Can I welcome you to your position? First Minister, I've been contacted by a number of constituents who have told me that their emergency accommodation in guest houses and serviced apartments here in the capital will be terminated as of yesterday, with no information about where they will be going, and in breach of the 4-week notice Council should be providing. Now, during the pandemic, welcome steps have been taken to provide accommodation for homeless individuals and families. So can I ask the First Minister, what is the Scottish Government's position on this critical issue? And will the First Minister also agree to Ministers bringing forward a statement on post-pandemic homelessness strategy and policy before this Parliament breaks for summer recess?
First Minister.
On the specific issue, I'm more than happy to look at the detail if Miles Briggs wants to send it to me. Obviously, it's principally a matter for the Council, but I'm happy to look at it in terms of what the Scottish Government might be able to do. More generally, we, at the start of the pandemic, through a lot of joint working, made significant inroads into reducing homelessness and rough sleeping, and it is absolutely essential that we continue that as we come out of this pandemic, and that is a key area of work that the Government is taking forward. We will publish plans or updated plans on that as quickly as possible, but on the specific, I'm, as I say, happy to look at the detail and reply in more depth if that is necessary.
Christine Graham, to be followed by Jackie Bailey.
Thank you very much, Presiding Officer. I welcome an announcement, First Minister, that borders will be moving to level 1, but I want to focus on the vaccination rollout, because I've had constituents failed by the National Vaccine Helpline and the missing appointments process, and I ask, therefore, that an assessment is made of the efficacy of these processes, including asking the public what their experience was. It is a minority, a small minority, but it's very stressful for that minority.
First Minister.
I think it is stressful for any individual who, for whatever reason, is finding it difficult to access their appointment. I think it is a minority, but if you're in that position, that doesn't matter to you to hear me say it is a minority. The overall programme is working incredibly well, and that's not just me saying that. That can be seen from the figures that we are reporting every day. As we go through this programme, we are trying to make changes where we can, if those can improve the experience for people. We are trying to make it more flexible. The walk-in vaccination clinics that have been operating in Glasgow, for example, I think we want to see more of that flexible walk-in approach taken across the country. That said, we also need to make sure that the systems we have in place, we stick with them to get through the programme as quickly as possible. Of course, it will be important that we reflect when we get to the end of this first programme, since I suspect this will not be a one-off vaccination programme, that we do take stock, that we hear the experiences of people, and we try to evolve and develop the system in future if we've not been able to do that as we go along. But notwithstanding the difficulties some individuals are having, I do want again to pay tribute to people who are working so hard to deliver this programme in every single community across the country.
Jackie Bailey, to be followed by Willie Coffey.
Can I also welcome the announcement about Western Bartonshire and Argyll and Bute moving to level 1? The majority of people are getting their vaccinations, and that is welcome. Unfortunately, that's not the experience of some of my constituents as well. Some people are waiting more than 12 weeks for their second dose. At one clinic, people were sent home because supplies of Pfizer had run out, and people in Western Bartonshire were told to go for their vaccination to the Hydro or Easter House, breaking the law by travelling into a level 3 area. As the First Minister accelerates the programme across the country, can she try to ensure that vaccinations are delivered as locally as possible?
First Minister.
Just to reassure MD in that position, of course, it is not breaking the law to travel to another area for an essential purpose, which getting a vaccine. But of course, that's not what we want in the bulk of cases. Issues of supply, we are restricted by supply, and that is one of the factors that unfortunately is out with our control. We are trying to strike the right balance. It's never going to be a perfect balance between very local access for people and mass vaccination clinics that get people through as quickly as possible. But there will be some people for whom travel to a mass vaccination clinic is not desirable or possible, and therefore that's why people have the ability to reschedule and rebook appointments. With a programme of this scale being introduced and implemented at this pace, I wish I could say otherwise, but it is not going to be absolutely perfect on every occasion for everybody. There are lots and lots of people, not least well, in government, although that's the least of it across the country, working hard to avoid difficulties for individuals. The programme is going well, and we continue to try to iron out and improve any issues that individuals are experiencing, and that process will continue.
Willie Coffey, to be followed by Rachel Hamilton.
Thank you. Can I ask the First Minister for an update on the take-up of vaccine registrations for the over-18s in Ayrshire, and what action is being taken there to combat no-shows, given the recent increase in case numbers in parts of the county?
First Minister.
We've seen good uptake of registration of 18 to 29-year-olds across the country, but also in Ayrshire using the online portal. I can, I'm sure, get the precise figure for Willie Coffey, but I'm not aware of any particular difference between the Ayrshire figure and the figure for Scotland as a whole. NHS Ayrshire and Arran has also written to all those who didn't attend their appointment to invite them to arrange a subsequent appointment. A second letter to all those who didn't attend their appointment has been sent nationally again, inviting them to reschedule. There's been a drop-in clinic for those who missed their first dose. There was one on the 23rd of May at Kilwinning Academy. I know the Health Board is planning a further drop-in session as well, and additionally carrying out outreach vaccinations to support their inclusivity plans. So this is an ongoing process. Nobody who doesn't turn up for their vaccine appointment will simply be forgotten. There will be considerable efforts to try to reach out and get people who've missed their appointment to reschedule, rebook and come forward for vaccination. And I would encourage all members, as I know all members already are, to continue to play their part in encouraging constituents to do that.
Rachel Hamilton, to be followed by Gillian Martin.
Thank you, Presiding Officer. Many colleagues today have raised the issue about no-shows, and I noticed that the First Minister did not respond to Anna Sarwar's specific question. So can I ask the First Minister, will she and her government commit to streamlining and improving the system of booking and rearranging appointments, given that many people now have work and family commitments whilst restrictions are easing? And will she commit to publishing the data so better decision-making can be made to ensure no-shows are kept to a minimum as we enter this crucial stage in lockdown easing?
First Minister.
My apologies if I didn't respond to a question earlier on. I'm in some of these questions getting asked understandably multiple questions, and I'm trying to answer as many of them as I can while I've got the BDI of the Presiding Officer urging me to be briefer. On do not attend, we are working on an ongoing basis to try to understand the reasons for people not attending and to address that. There is more of an approach as we go down the age bands for flexible drop-in appointments rather than booked appointments. The online portal for registration is also helping make sure that people's address details are fully up to date. To reassure people, health boards are also on a daily basis overbooking appointments, so that if there is a percentage of people not turning up, that is not reducing the overall number of vaccinations that they're doing in a day. So you can look at the daily numbers right now. We are seeing the expected daily numbers, notwithstanding a proportion of DNAs. But for protection purposes, we want to get that down. We publish a lot of information on vaccination. I will look to see what more we can publish as we go through this programme. Our vaccination rates are broadly in line with the rest of the UK. We're all dealing with these challenges. We're all dealing with them in slightly different ways, but we are continuing to make progress and learn and evolve the system as we go.
Gillian Martin, to be followed by Pauline McNeill.
Thank you, Presiding Officer. South Africa has reported it's entering a third wave and has reimposed lockdown restrictions. And we've also heard reports from Poland, France and Germany, and this week that Professor Ravi Gupta warned that the UK could be heading for the same. I was particularly concerned to see images of people not adequately socially distanced at airport queues over the past week. And can the First Minister reiterate the importance of isolating when returning from abroad, particularly from red list countries? And can she give details on what quarantine arrangements are in place for those who work abroad, particularly in oil and gas?
First Minister.
I'm happy to write to Gillian Martin with specific details about oil and gas. Generally, though, we ask people to comply with the rules that are in place for red, amber and green list countries. We continue to discuss with the UK Government on an ongoing basis how we ensure that the controls at the borders are as tight as they need to be. And I won't go into detail, but I have spoken about the frustration I've had about that in the past, and we continue to try to make sure that we have as tight a system as possible. Gillian Martin is absolutely right to draw attention to the fact that this global pandemic is not over. The WHO are at pains almost on a daily basis to remind countries that we are not out of this yet. The UK as a whole is in a relatively strong position because we have one of the highest vaccination rates in the world right now, but we also have the new variant, the new Indian or Delta as it's now called variant, spreading quite significantly. So there's upsides, as I said, but there's also significant challenges, and that means continuing to abide by all of these rules, particularly around international travel, is important. My advice remains to people, unless it is essential, do not travel overseas right now, because that is another important way that we can reduce the risk that new variants of the virus pose to us.
Pauline McNeill, to be followed by Stuart McMillan.
Does the First Minister agree that it's time for a specific recovery plan for Glasgow, a city that has been in lockdown for 9 months? But serving people beyond its boundary has metropolitan status, where the economic damage has been deep and the vaccine rollout has not matched the density of our population with high levels of the virus. I plead with the First Minister to recognise that Glasgow will continue to be in trouble. It's such an important city for the west of Scotland as a whole, and already 90% of businesses did not qualify for additional support, and I didn't get the impression that this had registered with the Government when it was raised last week.
First Minister.
Well, I hope Parliament will recognise that I am not somebody who needs to be reminded of the importance of the city of Glasgow. It is my home. It's also where my constituency is. So I know personally, but I know on behalf of my constituents how important it is that we get Glasgow out of the current situation, back on track, and then in the medium to longer term work with the City Council to support economic recovery. The Deputy First Minister has had discussions with the City Council. Their preference is that the Government works to support them in the recovery plans, and that is what we will do. The measures we have taken in Glasgow, very specific, bespoke measures over the past couple of weeks, which, as I was saying earlier on, will now inform learning in other parts of the country, have been effective. We are back on a better track in Glasgow, but there will continue to be a need for economic support for a significant time to come, and that is where we will continue to work with the City Council.
Stuart McMillan, to be followed by Rona Mackay.
Thank you very much, President Officer. First of all, I welcome that Inverclyde is moving to level 1. But can the First Minister indicate what update has been provided to the cruise line sector with regards to the easing of travel restrictions, bearing in mind how important that sector is to my Greenock and Inverclyde constituency?
First Minister.
If Stuart McMillan will forgive me, I know that is under consideration at the moment, but I am struggling in the moment to remember whether we have taken a final decision and notified that yet or still in the process of doing that. So I'll check that after I'm out of the chamber for the statement and write to him. Obviously, the cruise sector is important economically, important for people who enjoy taking cruises, but we also know from experience at the outset of the pandemic that cruises can pose a high-risk environment as well, which is why continued care and caution around the mitigations that are necessary will be required. But I'll come back to Stuart McMillan as soon as possible.
Rona Mackay, to be followed by Jamie Green.
Thank you, Presiding Officer. Figures released this week reveal an increasing number of assaults on police linked to coronavirus. Will the First Minister join me in condemning this sort of abhorrent behaviour and in thanking police officers and staff who have done a tremendous job throughout the pandemic, despite the extremely challenging circumstances?
First Minister.
Yes, 100%. I would very much like to take the opportunity to thank police officers and indeed police staff for the incredible job they have done throughout a year, more than a year now, that has posed significant challenges for them. There is never any excuse for assaulting in any way, shape or form a police officer, but some of what we have heard in recent days is particularly inexplicable and I think beyond the comprehension of decent people everywhere. This has been a really difficult time for the police, having to police sensitively, as they have done, the regulations in place, help people in a range of different ways, and they deserve our gratitude for the wonderful job that they have done, often putting themselves at risk in the process.
Jamie Green, to be followed by James Dornan.
Thank you. Can I echo the comments just made by the First Minister? But constituents in my region moving from North Ayrshire to Inverclyde to Renfrewshire to Western Bartonshire are moving from tiers 2 to 1 to 2 to 1 again. To avoid any potential public confusion, can I ask if travel restrictions will remain in place across tiers, and what specific advice has been given to Police Scotland on how they ought to enforce today's latest restrictions?
First Minister.
The areas that the member has just mentioned there, yes, that does involve going from level 1 to level 2 areas and back again, but that is because we are not taking a one-size-fits-all approach. If I was to follow the advice I think Douglas Ross was giving me earlier on, there would be many more subdivisions of that, and people perhaps within Inverclyde or within one of the Ayrshire councils would be going from different levels of restriction within the council area. So, in a sense, Jamie Green is illustrating my point. The easiest thing to do is have a one-size-fits-all, but it's not the most proportionate thing to do, and in a public health sense, it's not an absolutely necessary thing to do. So we're trying to be as targeted as possible, but also try to recognise the travel patterns that exist. There are no travel restrictions in place underneath levels 4 and level 3, and that means that people are able to travel freely, but it also means that as we give people rightly the ability to do more, we all have to exercise more responsibility and take care. This is not easy, but this is the very nature of having a situation that is not blanket one-size-fits-all. And it's also illustrating why you have to do it at a sensible level and not in the way that I think Douglas Ross has been advising me to do.
James Dornan, to be followed by Neil Gray.
In light of the news around the Janssen one-dose vaccine being approved for use in the UK, can the First Minister give an indication of whether vaccination centres in Scotland will use it and who is most likely to be a priority for receiving it?
First Minister.
It is very good news that the Janssen vaccine has now been authorised for supply in the UK. We are expecting that we will secure around 20 million doses overall for the UK, with Scotland receiving a proportionate population share of all vaccines indeed that are procured. So we would anticipate, although this is not certain yet, that some doses of this vaccine will be available for use in Scotland later this year, and if that is the case, we will incorporate that into our modelling. But of course we are basing our modelling right now on the supplies of the vaccines that we know are available and are already flowing through the supply route, and that's what we will continue to do.
Neil Gray, to be followed by John Mason.
Thank you, Presiding Officer. I thank the First Minister for her statement and understand the balanced decisions that the Government had to take today, particularly around North Lanarkshire's move from level 2 being delayed. And though clearly we must proceed with caution, can she advise whether the 2-metre rule is under review as we move through the levels? So this is of particular concern for churches in Airdrie and Shotts who have been in touch with me, and can she also advise what support is available for people who are apprehensive about readjusting to changes of restrictions as we move forward, a particular concern highlighted by mental health charities?
First Minister.
Well, can I thank Neil Gray for two very pertinent questions. I set out, I think, 2 or 3 weeks ago now, that we do intend to have an overall review of physical distancing. We haven't concluded that yet. When we do conclude that, we will publish the outcome of that as we go further into the summer. And if we do stay on track, as I hope we will, then I hope we will be able to reduce the distancing requirements. If not immediately in all settings, then in many settings, and I know churches have a particular interest in this. So it is very much something that is under review. On the second point, I understand, I know people in my own life who have that tentative feeling about getting back to normal again. It can make people anxious and stressful. What I would say to people is take comfort from the fact that we are continuing to take a cautious approach to this. If you have had your 2 doses of the vaccine, you have significant protection against this virus. But it makes sense to continue to be cautious about face coverings, hand hygiene and distancing for the moment, because these are the things we know help to keep people safe from getting it and transmitting the virus.
John Mason, to be followed by Paul O'Kane.
Thank you, Presiding Officer. The fan zone for the European Championships was mentioned earlier on. I wonder if the First Minister can reassure my constituents who live near Glasgow Green and are a bit nervous about so many people coming into the area.
First Minister. Well, I can understand people's nervousness. My constituents also live, or many of my constituents live reasonably close to Glasgow Green as well. These are difficult decisions. On the one hand, all of us want to be able to see Scotland play in the Euros and to see the Euros more generally, to have fans in the stadium, to have the ability of fans to enjoy the tournament more generally. We also want to see events start again and to have the assurance they can happen safely. But on the other hand, I know that people, perhaps those to whom football is not as important as it is to many, think, well, if I'm still under restrictions, why do we have large-scale events? We're trying to get the balance of all of this as right as we can. We're working closely with the event organisers on preparations for the proposed fan zone. The situation with the virus will be continually reviewed in the run-up to the Euros, taking into account all of the latest evidence and information, but the action that we're all taking is not about allowing a football tournament to go ahead. It's about allowing us to get everything, or as much as possible, in our society back to normal. The arrangements for the proposed fan zone have lots of mitigations in place to minimise risks of transition. I think there's been a meeting today, or if not today, then tomorrow, around this, and these matters will continue to be kept under review. We want to allow fans to safely enjoy the Euros, hopefully enjoy being the operative word, and we will work hard to make sure that is the case. But public safety and protecting people against this virus continues, of course, to be our overriding priority.
And Paul O'Kane.
Thank you, Presiding Officer. The news today that East Martinshire, Renfrewshire, East Renfrewshire and North Ayrshire will remain in level 2 is disappointing and will be disappointing for local people and businesses. But I have been contacted by people in my region aged between 30 and 39 who are anxious that they've not yet been called for vaccination, despite the encouragement of people in the 18 to 29 age group to register. We heard last week from the Cabinet Secretary for Health that the online portal that's used for 18 to 29-year-olds was being urgently looked at to be extended to the 30-plus age bracket. So it would be useful to understand from the First Minister if she will urgently consider looking at that online registration, and indeed could there be a more standard online booking process, and of course the walk-in provision for areas of concern, those remaining in level 2 at the moment.
First Minister.
Firstly, can I welcome Paul Kane to the Chamber. We certainly are considering extending online registration and, as we perhaps go into another round of this vaccination programme, online booking. So these developments will be kept under review. But in terms of over 30s, these appointments should all have been scheduled. So if anybody in that age group hasn't had a letter, then rather than wait for an online registration system, I would encourage them to go through the vaccinations page to check what has happened, and if there has been a missed appointment, to get that appointment scheduled as quickly as possible. So yes, we will consider extending it, but that's not the solution to anybody right now in that age group who hasn't had the appointment they've been expecting.
Thank you. And that concludes the COVID-19 update. I'll take this opportunity to ask that members continue to observe social distancing measures, including when entering and exiting the chamber. And please only use the aisles and walkways to access your seat and when moving around the chamber. The next item of business is a debate on motion 144 in the name of Humza Yousaf on health recovery. I will Just take a moment to give members time to move. I will now call on Cabinet Secretary Humza Yousaf to speak to and move the motion.
Thank you, Presiding Officer. COVID-19 has profoundly impacted families right across our country, with loved ones unfortunately dying as a result of this terrible virus. It's a loss that has been compounded by the necessary societal restrictions in place. Not least I can think of the harm that has been done to families who have had to miss, for example, funerals of a loved one. I want to offer my sympathies, and I'm sure those of the whole chamber, to those that have lost a loved one, a relative or a friend. While the pandemic has not gone, our NHS vaccine programme and the efforts of the people of Scotland has drastically and dramatically reduced the impact on our NHS. However, I don't think anybody does, and we should never underestimate the significant challenge that responding to COVID has had on our NHS. While someone may not have had COVID-19 themselves, this pandemic may well have impacted their health in other ways, both physical and mental. Before I go into details of my thanks to our NHS staff, can I say what an honour it is to be taking part in this debate, to be opening this debate and to have been appointed Health Secretary. I suspect all of us across this chamber will have our own stories of how the Health Service, the National Health Service, has impacted our lives. I'm sure we'll hear some of those stories today. I know when people have asked me over the last 2 weeks how I felt about being appointed Health Secretary, I've often said to them that I'm somewhat daunted by it, and that's how it should be. Being entrusted with the health of the nation is a huge responsibility during normal times, let alone while still in the midst of a global pandemic. And during my first visit as Health Secretary last week, my first official visit, I heard firsthand from the staff at Monklands Hospital about how they responded to the challenges of the pandemic. In my first debate as Health Secretary last week, I put on record my thanks and admiration for the exceptional care all NHS and social care staff have delivered through this pandemic. Our NHS and care staff have indeed answered the nation's call at our time of greatest need. Their efforts on testing and vaccination have been incredible. They've been and are the bedrock on which we build our national recovery. More than 5 million doses of the vaccine have been administered in Scotland, with over 2 million people having had both jabs. And as of today, 99% of people aged 50 and over have had their first dose. And we remain on track to complete all first doses by the end of July, if not, hopefully, possibly even earlier. In response to the higher levels of COVID-19 in Glasgow, the Health Board have opened up walk-in clinics to help speed up getting vital second doses into as many people over the age of 40 as possible. Of course I will.
Alex Cole-Hamilton.
I'm very grateful to the Cabinet Secretary for giving way, and I'm very grateful to the engagement he's offered me about the outbreaks in Davidson's, Mains and Silver Knowes in my constituency. Given that he has offered in hotspot areas of Glasgow walk-in vaccinations for those who have not yet been offered their first or second jab, would he make that same provision available to my constituents?
Cabinet Secretary.
So, of course, that would be a decision for the local health board. I spoke to Lothian Health Board, both the Chair and the Chief Executive, last week. I'm speaking to the Chief Execs again tomorrow. I will certainly impress upon them that I think there is great merit in walk-in and drop-in clinics. We've seen, for example, over the weekend, an additional 1,700 people getting vaccinated on top of those who were scheduled for appointments over the course of Saturday and Sunday. I would like to see these drop-in clinics, walk-in clinics, being extended right across the country. So I'll impress upon Lothian Health Board when I discuss this matter with Chief Executives tomorrow. Our NHS has continued to provide care, ensuring those with the most urgent needs were treated. But we have to be frank about the impact that the pandemic has had on the NHS. That's why within 100 days of this government, we're going to publish an NHS recovery plan that aims to not only restore activity to previous levels, but crucially, as many members across the chamber have urged us to do, to exceed them. We will work with the front line to design and implement sustainable ways of ensuring people are seen more quickly while maintaining quality of care. We will not wait for the recovery plan to be published to remobilise our NHS. We've already opened our first of the 3 new fast-track cancer diagnostic centres in NHS Dumfries and Galloway. It's already started seeing patients, with the other 2 centres opening their doors within a matter of a few weeks. Since screening programmes resumed in August last year, almost 300,000 patients have had their breast and cervical screening. Pausing the national screening programmes was one of the most difficult decisions this government has had to make. That is why the safety of patients, the public and indeed staff is our priority as we now deliver and expand. It's crucial that we detect cancer early, so it's vital that people don't ignore their invites, and anyone with concerns or symptoms should contact their GP practice without any delay. Plans to remobilise local services with focus on supporting staff wellbeing, embedding sustainability are now being implemented. In NHS, Ayrshire and Arran, that has included the Scottish Government funding the buyout of the PPP East Ayrshire Community Hospital that was announced by the First Minister last week. I'm clear that the recovery of our services will not be possible without the recovery of our workforce. A range of wellbeing and mental health resources have been put in place locally, which staff tell us they value. These are being supplemented by national resources, such as the National Wellbeing Hub, which now has had over 100,000 users, and the National Wellbeing Helpline. It is, of course, easy for us all to clap our hands, to embrace the NHS staff with warm words, but we are determined as a government to show them through our actions how much we value them. We will build capacity for recovery by better managing unscheduled demand. This is where our GPs and primary care sector are vital, releasing capacity in our hospitals. Primary care are best placed to maintain care within a person's home. Linking GPs as our expert medical generalists with their acute sector colleagues will improve referral and discharge. This will be central to ensuring people suffering with long COVID, I know an issue important to many people across the chamber, that they get the range of services they need. Our multidisciplinary approach to primary care will empower our frontline nursing staff. We will increase pharmacy support in GP practices. That will allow medication and polypharmacy reviews to support self-care. We must also increase training and recruitment of first-contact physiotherapists to meet anticipated increase in musculoskeletal issues. And we'll further increase investment in community link workers. I know many of us have seen the value of those link workers in our own constituencies. We will further increase that investment to ensure every GP practice has access to a mental wellbeing link worker to better deliver social prescribing. We shouldn't lose sight of just how critical digital technology has been to our pandemic response. The use of the Near Me video consulting service rose from around 300 consultations pre-pandemic to over 20,000 per week now. Its utility has seen it now being adopted as an approach in England and Wales too. I should stress that digital and telephony services are, of course, a great tool for our NHS, but that people seeing medical professionals in person will clearly continue to be vital to the care that we provide. In recent years, there has been a welcome shift in the provision of inpatient treatment towards day cases. We will continue to make greater use of our community hospitals. For example, we provided targeted investment in NHS Lothian to make greater use of the theatre capacity at East Lothian Community Hospital. Our resilience and ability to increase elective activity is aided by expanding our ICU capacity. We've increased investment in ICU throughout COVID and will increase ICU beds from 173 to at least 203 on a permanent basis. Of course, the NHS remains able to double the national adult ICU capacity to 360 beds within 1 week and to treble it within 3 weeks to 585 beds should it be required. A challenge that the UK Government could help address is the effect pension changes have had on disincentivising NHS consultants from engaging in waiting times initiatives. I have today written to the UK Chancellor Rishi Sunak to seek early discussions with the UK Government and the BMA on doctors' annual allowance and lifetime allowance for pensions, in order that flexibility is allowed to encourage greater activity, with leading to punitive tax charges for doctors. In terms of mental health and wellbeing, I know this is an issue that has been raised by many members across the chamber in the last couple of weeks, and I wanted to address some of those issues, although my colleague, the Minister for Mental Wellbeing, Kevin Stewart, will no doubt elaborate on this in his closing speech. And mental wellbeing is, of course, just as important as, of course, physical health. People who may never have been affected by mental health issues are now facing emotional distress due to the impact of the pandemic. Our NHS Recovery plan will include action on improving mental health and wellbeing services, and we will increase direct investment in mental health by 25% over the course of the Parliament. Of course I will.
I'm grateful to the Cabinet Secretary for taking an intervention. Mental health funding in England and Wales sits at roughly 11% of the overall health budget, yet in Scotland it's something like 8.5%. Will he get it to 11% by the end of this Parliament?
I'm sure Jackie Bailey is grateful for the Cabinet Secretary taking an intervention, but I would appreciate it if she'd wait to be called by the Chair. Cabinet Secretary to respond.
Forgive her, Presiding Officer, she is new to this, not much experience. We will commit, as we did in our manifesto, to increase that spend by the lifetime of this Parliament to 10%, and we have already increased some of our additional spending in relation to mental health, and we'll continue to do that, particularly if there are further COVID consequentials that come our way. So there will be a substantial increase in mental health spend, and already some of that spend is making its way to Health Board to address, for example, the waiting times in relation to CAMS. As well as mental health services, within our first 100 days we'll also publish a women's health plan to tackle inequalities by raising awareness around women's health and improving access to health care for women throughout their lives. And Marie Todd will take this work forward as the First Minister to have a dedicated focus on women's health. Within the first 100 days, we'll also bring forward a bill to enable the reimbursement for those who have paid to have mesh removal surgery out with the NHS, and I look forward to working with members across the chamber to implement this. In conclusion, Presiding Officer, our commitment to create a national care service will deliver services founded on fairness, equality and human rights, and placed on the same level of esteem as our National Health Service. This will be the most significant public sector reform since the creation of the NHS in 1948, and will be operational within the 5-year lifetime of this Parliament. In our first 100 days, we will begin the consultation on the necessary legislation with a view to introducing it in the first year of this Parliament. We will also establish a social covenant steering group, including those with lived experience who use our care services, to ensure that they are part of the co-design process. I look forward to working across the chamber to protect and support our National Health Service and create and develop our National Care Service. I know that everyone across this chamber cherishes and values the work of our NHS and care staff and all that they have done in this pandemic. Presiding Officer, there are many voices with experience in and of our health and care service in our Parliament. I look forward to hearing them during this debate, and together we have an opportunity to develop a very broad consensus on how our NHS recovers from the pandemic. As Health Secretary, my door will always be open to positive ideas coming from right across the chamber for improving the care that we give our nation, and I move the motion in my name.
Thank you, Cabinet Secretary. I now call Annie Wells, who joins us remotely, to speak to and move Amendment 144.4 in her name. Annie Wells, you have 7 minutes. Thank you.
Thank you, Presiding Officer. I am grateful to be given the opportunity to speak to the Scottish Conservatives amendment in my name and to the Government's motion. I wish to extend the condolences from my party to all those that have lost a loved one due to COVID. We welcome the commitment from the Government to produce an NHS recovery plan within 100 days, but we are keen to go further. As the vaccine programme continues to roll out across Scotland and the UK, it is giving us further confidence that we can soon put this pandemic behind us and return to a life that resembles normality. In the meantime, I am sure this chamber is entirely united in expressing our continued gratitude to our fantastic NHS staff. Presiding Officer, although we are making substantial progress against containing COVID, we cannot afford to turn our attentions away from other significant challenges. Indeed, some of these challenges may be with us a long time after the immediate effects of the pandemic have passed. And it truly is remarkable and a testament to their dedication that over these past 14 months, NHS staff have treated thousands of sick COVID patients. However, as I said in the Chamber last week, the NHS backlog is at great risk of spiralling out of control. If urgent action is not taken, we could be heading for a full-blown healthcare crisis. As borne out by the latest Public Health Scotland statistics, around 28,000 patients have spent 52 weeks or more on an NHS list awaiting planned hospital treatment. And it's also true that as of March 2021, around 100,000 Scots are still waiting on key diagnostic tests. We have already heard stark warnings from leading charities such as Cancer Research UK about the impact this could have upon tens of thousands of Scots across the country. As part of the pledges in our manifesto, the Scottish Conservatives had committed to an additional £600 million to tackle the NHS treatment backlog in 2021-22. Crucially, we also called on the SNP government to speed up the delivery of early cancer diagnostic centres, and I am pleased to see that this is now being delivered, and also prioritise boosting the diagnostic workforce. This is key to tackling the hidden backlog of those who are yet to be referred due to the pandemic. There is no doubt that the NHS backlog will be a source of acute concern for those waiting longer for care and treatment, as well as their families and loved ones. Therefore, it is a welcome step that the Scottish Government have pledged to produce an NHS recovery plan. However, we have stressed that the promise to increase in inpatient, day case and outpatient activity must not come at the expense of the time consultants are able to spend with a single patient. Given the immense gravity of this challenge, tackling the NHS backlog must be a top priority for this new Parliament going forward. As such, we cannot spend the next 5 years stuck in the same debates and disagreements that held back the last Parliament. Presiding Officer, I also recognise, like many aspects of our society and economy, COVID-19 has had some tremendous impact on our social care system. We welcome the Feely Review and support many of the recommendations put forward to Scotland's social care system on a more sustainable footing. And as I made clear last week, I very much look forward to working with the Cabinet Secretary for Health and Social Care, councils, families and providers on this matter in the weeks ahead. The Scottish Conservatives have also repeatedly called for an immediate judge-led inquiry to uncover the truth into what happened in our care homes, where over 3,000 people tragically lost their lives. I recognise the incredibly tough job ministers have had during the pandemic, but grieving families deserve answers from those responsible for making those key decisions as soon as possible. Presiding Officer, the Scottish Conservatives are calling for a women's health plan to be brought forward within 100 days, and I was pleased to hear the Cabinet Secretary say that Marie Todd will take this forward, because as we remobilise the NHS, we need to better shape the services that are needed by women of all ages, but have often fallen short in the past. On an issue spearheaded by my colleague Jackson Carlaw, we also believe that we are calling for a bill on the restitution for victims of the mesh scandal, and I look forward to working across the Chamber with the Cabinet Secretary on this issue. Presiding Officer, as the Scottish Conservatives motion makes clear, we want to see this government make a serious commitment toward tackling Scotland's drug death crisis. We have appealed for cross-party support to tackle drug deaths by opening up access to treatment and rehab programmes. In this spirit, I welcome the number of funding announcements made last week by the Minister for Drugs Policy. It is a welcome first step, but much more needs to be done to tackle this crisis, which, quite frankly, is Scotland's shame. I look forward to working with other parties across the Chamber on this vital matter, as I am determined to build a consensus around new legislation to ensure no one is denied the rehab support they need. To sum up, Presiding Officer, although I welcome the Scottish Government's commitment to an NHS recovery plan, I believe we could go further in certain areas. I will continue to make the case that this Parliament's head must be strictly focused on tackling our various health emergencies, and I will also work with any member across the Chamber who believes Scotland's recovery must come first, and I move the amendment in my name.
Thank you, Ms Wells. I now formally call on Jackie Bailey to speak to and move Amendment 144.1 on behalf of Scottish Labour. Ms Bailey.
Thank you very much, Presiding Officer. You're clearly worth a watching. Even before COVID-19, health services were struggling to keep up with demand and there was a growing backlog of care. The pandemic has made things worse. It's exacerbated existing inequalities. So we need to understand the scale of the challenge we face. More than 290,000 people had waited more than the 12-week treatment time guarantee before the pandemic. Now that figure has reached 400,000. The 62-day waiting time standard for urgent cancer referrals has never been met since 2012. Public Health Scotland tell us that there have been 7,000 fewer cancer diagnoses in 2020. So thousands are living with undiagnosed conditions. Some may have indeed died. Almost 106,000 patients waiting for a diagnostic test, an increase of 25%, and almost 5,000 of them have waited over a year for an endoscopy. The 18-week waiting time for mental health services has never been met. Thousands of young people are still being rejected from specialist CAM services. Deaths from suicides are rising, and our mental health has worsened during the pandemic. Today's mental health statistics highlight the stark reality facing many people across Scotland, and it is shameful. The NHS has been underfunded for years, demand is increasing, and we don't have the staff to cope. So we are facing a perfect storm. The warnings from respected stakeholders like the Royal College of General Practitioners and the BMA are stark. They tell of GPs and NHS staff who are burnt out. Having worked on the front line throughout the pandemic, some are now taking early retirement. They talk about workload pressures, the lack of staffing, the lack of resources. Now, we all agree that we need to remobilise the NHS and catch up on the backlog quickly. But we cannot begin to do that unless we take care of the staff, because they are the backbone of the NHS, and without them, we have nothing. Like everyone who's spoken so far, I thank NHS and social care staff for everything that they've done to keep us safe. But they need more than our thanks. They need our support and they need action. So when the Royal College of General Practitioners says they need action on workforce planning or a mental health worker in every general practice, please listen and please act. They were promised multidisciplinary teams in GP surgeries, but that's been implemented at snail's pace. They cannot wait any longer. And when the BMA calls out the fact that consultant vacancies are deliberately underreported and says that staff well-being needs to be a priority, then please listen and please act. This Scottish Government have not been good at workforce planning. No, indeed it was Nicola Sturgeon as Health Minister that cut the training places for doctors and nurses that have led to the crisis we face now. So we need to immediately increase the number of training places for doctors, nurses and allied health professionals. But we need to do more than that to retain staff now. The task is huge, and the Labour Health team will work with the Cabinet Secretary to try and make things better. But we will also be critical if we feel he is getting things wrong. So let me turn to one area where there are real concerns, and that is cancer. The pause in the screening programmes has meant that as many as 7,000 people could have cancer that have not been diagnosed. We all know that early diagnosis and treatment gives the best outcomes. Yet waiting times are far too long. The number of people waiting for diagnostic tests has risen. It's 20% higher than pre-pandemic levels. We know that cancer is higher in deprived communities. People are usually diagnosed later, and their outcomes are therefore poorer. As Macmillan point out, we need urgent action to deliver the Cancer Services Plan, but we cannot simply return to pre-pandemic levels of activity, as we need to deal with increased numbers. I'm sorry, I've got a lot to get through. The First Minister said to this chamber that we would use capacity from wherever we can find it. And I agree with her. So how disappointing to learn from the minutes of the National Cancer Recovery Group on the 19th of March that the majority of private sector capacity will cease at the end of March. The same minute expressed concern from clinicians about the impact of the loss of this additional capacity. This at the same time as urgent breast cancer referrals are currently 42% above pre-COVID levels. I suggest that the Cabinet Secretary acquaints himself with this minute. And whilst I'm not a fan of private medicine, simply cutting off that valuable capacity that would help us catch up without having anything in its place is simply unforgivable. The Cabinet Secretary's predecessor used the private sector to bolster capacity in the NHS. It is short-sighted to end it when that capacity is clearly still required because it might make the difference between somebody living or dying. Finally, Presiding Officer, I want to turn to social care. Care homes were at the epicentre of the pandemic and more than a third of all deaths were recorded there. Social care staff put themselves in danger to care for our older people. They did so with inadequate PPE, without testing being available, with ever-changing guidance. We can never thank them enough for their bravery, but clapping for them is not good enough. This is a predominantly low-paid female workforce, but we can change that. We can value social care staff. Labour's amendment repeats our budget call. Pay them £12 an hour now, then move to £15 an hour over the lifetime of the Parliament. The Greens voted against it in the budget, but then put it in their manifesto. And I welcome that change of heart. The money is there to do it. Almost £1 billion is sitting in the Scottish Government's coffers unallocated. It would more than cover this. There would be plenty left over to also fund an urgent increase in cancer care. And the Cabinet Secretary, I recognise, wants to do the best. Maybe he should start by doing that. He has a tough job ahead. He has to steer through the legislation to create a national care service. Labour proposed this 10 years ago and Nicola Sturgeon rejected it. I suspect she did so, Presiding Officer, because the idea came from us. Well, paying social care workers £15 an hour is another Labour idea. Let's not wait 10 years to implement it. Do it now, transform the social care sector and show you really do care about our older people.
Ms Bailey, I'm not sure... A second admonition in the space of an afternoon. Thank you very much, Ms Bailey. I now call on Gillian Mackay to speak for the Green Party. 4 minutes, Gillian Mackay.
Thank you, Deputy Presiding Officer, and welcome to your new role. I welcome the commitment from the Scottish Government to produce an NHS recovery plan within the first 100 days. It's great to see tackling waiting times on the Cabinet Secretary's agenda, but those who have been waiting for a long time for treatment will want to see this acted on quickly. While the speed with which the Government wants to work is very welcome, the remobilisation must be sustainable and not push an already tired workforce to breaking point. Establishing mental health support and additional staff for services such as cancer screening and GP appointments must rise in line with demand to ensure our current workforce feel that the sentiment expressed in this chamber can be turned into action. I again want to thank our incredible health and social care workforce and have witnessed firsthand in the last 6 months the amazing kindness, strength and empathy they have shown in the face of this pandemic. As many in the chamber will be aware, we lost my mum in December and my grandpa just over 2 months ago. Without the nurses at the stroke ward at Forth Valley Royal Hospital, we wouldn't have had those last few precious phone calls with mum. I'm forever in their debt, and I will fight for the working conditions they and all their colleagues deserve. We must take this opportunity to transform the way we look at healthcare in Scotland. In recent times, our NHS has been a national sick service. I hope that this Parliament and some creative thinking, we can move towards a truly national health service. We will have challenges, long COVID and the backlog of screening and surgeries to name a few, but we can start embedding system change now. We also have to look at the drivers of poor health and seek to address them working across portfolios, which is something we as a Parliament maybe haven't been the best at previously. Let's take advantage of a fresh session and sort that. We, and I mean we as MSPs, have to look at how we solve the drivers of poor health. Air pollution, access to good food, housing and poverty all have an impact on our health and well-being. According to the NRS, those living in the most deprived areas of Scotland may die up to 10.5 years younger than those living in our most affluent communities. Poverty and poor health are intrinsically linked, and this is a cycle we have to break for the good of generations to come. Low wages that force families into food banks have to be eliminated, and hungry children should be prioritised over bonuses and tax breaks for wealthy individuals. I absolutely welcome the establishment of a national care service, and again, as many of you know, it's an issue close to my heart. My grandpa received wonderful care, and his carer's work allowed me to continue to be his pal for his final few months. So to James and the rest of his carers, I can never say thank you enough. But Gramps had me on a promise to make sure that both paid and unpaid carers are looked after. Another promise I made during the election was to the many disabled people that we all met. I promised to be a voice for them, and I wish to fulfil part of that now by challenging the Cabinet Secretary for Health to make a commitment to actively listen to and crucially act upon the input of disabled people, their families and other service users when designing our National Care Service. We need to make a service that has human rights at its heart and allows them to live to their full potential. Thank you.
Thank you very much indeed, Ms Mackay. Before calling Alex Cole-Hamilton, could I remind all members who wish to speak in this debate to press your request to speak buttons if you've not already done so. And I call Alex Cole-Hamilton to speak on behalf of the Scottish Liberal Democrats. 4 minutes.
Thank you very much, Deputy Presiding Officer, and can I warmly welcome you to your place. It's great to see you up there. Before I begin, can I also thank the Health Secretary for bringing this debate to Parliament so swiftly in this parliamentary term, and indeed for the inclusive way that he's reached out across the aisle in the first days of his tenure. 2 weeks ago, I received my first dose of the AstraZeneca jab. My constituency is home to 3 vaccination centres, and I got my jag from a constituent that I have helped with unrelated casework. It's wonderful how small a village Edinburgh can feel sometimes. She was one of the first to volunteer with the vaccine programme. And it's no understatement, Presiding Officer, to suggest that the work of our vaccinators is truly remarkable, and it gives us all such hope that through their efforts, the nightmare of COVID-19 may finally be coming to an end. As such, it is right that we should now start to devote parliamentary time to the remobilisation of the NHS and the much-needed reform of our social care service. But Liberal Democrats cannot support this government motion unamended. Whilst much of its sentiment is laudable, we do not support the establishment of a national care service, because whilst social care is unquestionably in need of reform in this country, and it needs parity of investment, we do not believe that the management and the control of that reform should lie in the establishment of another centralised bureaucracy. The motion also implies that the principal source of delay in treatment that our patients experience is the pandemic. But the coronavirus emergency has certainly made a bad situation worse, but this government was failing patients long before anyone had ever heard of COVID-19. Presiding Officer, I have lost count of the number of patients who have come to my surgery clutching letters advising them of their right, their legal right, that this government enshrined in law, to be seen in 12 weeks when there isn't a hope of them being seen in 50. Nevertheless, I am glad that this motion begins to acknowledge the backlog created in both our mental and physical health service and aims to redress this balance. But it's simply not good enough to aim for pre-pandemic standards. We must do better with proper workforce planning, major investment, particularly in mental health services and in screening services, because, as we know, cancer has remained the biggest cause of death in Scotland. Even when the COVID-19 virus was at its peak, cancer did not slow down during the pandemic, but diagnosis rates did. In 2020, cases of cancer in Scotland fell sharply, and for several months, national screening services for breast and bowel cancer and cervical cancer were stopped completely. The impact of this is still being felt now. As of March this year, the number of people on waiting lists for this vital diagnostic test is 25% higher than it was last year. Now, awaiting a cancer diagnosis test is not only physically dangerous, but the mental strain that it puts on patients and their families cannot be overstated. As the Scottish Government attempt to tackle these huge waiting lists, they must do so in a way that will lead to long-term improvement in cancer services so that no one is facing long and traumatic waits to receive that diagnosis. Now, in February, by backing the Liberal Democrat motion, this Parliament declared a national health emergency, a crisis indeed. And a recent survey of over 1,000 people underscored the extent of that emergency. It found that 13% of those who tried to speak to their GP about their mental health during the pandemic had been unsuccessful. And, Presiding Officer, we learned this morning that since Christmas, in the field of child and adolescent mental health, the list of children waiting more than a year for first-line support has grown by a third. As I conclude, Presiding Officer, I want to thank the Government for its commitment to MESH survivors. It enjoys the support of every party in this chamber to that end. And I want to restate my admiration for all our NHS and social care staff for the work they've done for us and will continue to do for us. This is one of the fundamental challenges set to us in this session of Parliament. It should command parliamentary time in nearly every week that we sit. And whilst we may disagree on how to get there, Liberal Democrats will play a constructive part on that journey. Thank you.
Thank you, Mr Cole-Hamilton. Could I now call Audrey Nicholl? Members will wish to be aware this is Ms Nicholl's first speech in the Parliament. Ms Nicholl.
Thank you, Presiding Officer. It's truly an honour to be elected to this special place as our nation begins its recovery from COVID-19. My grateful thanks to my campaign team, my loving family, activists and all my constituents in Aberdeen South and North Kincardine. I pay special tribute to Maureen Watt, the First Minister for Mental Health, for her lifetime commitment to the constituency. She'll be a very hard act to follow. I will shamelessly big up Aberdeen South and North Kincardine, home to a thriving food and drinks industry, higher education, innovation and stunning coastlines. But it's also the home to a global energy sector. However, the sector is now experiencing a significant downturn, placing jobs and livelihoods at risk. This situation has been compounded by the pandemic and a disastrous Brexit and created a perfect storm that has had a profound effect on many, specifically their mental health. Following a 31-year policing career, I joined the School of Nursing, Midwifery and Paramedic Practice at the Robert Gordon University, delivering nurse education across the health and policing intersect. Never did I imagine that while lecturing to my first years on global health challenges, weeks later they would be facing the prospect of their first placements on the front line of one. I pay tribute to them all, to all NHS staff and all my colleagues who also returned to the front line. I pay tribute to former colleagues in the emergency services, particularly Police Scotland, who had to balance daily law enforcement duties using emergency COVID legislation and responding to the growing demand from mental health distress. Presiding Officer, I'm pleased to focus my first speech on mental health in support of this motion today. Even the most resilient of us felt the mental health impact of the pandemic. But for young adults, those on low incomes and others, the impact was significant, especially where access to care, treatment and psychological therapies was curtailed. The Mental Health Transition and Recovery Plan builds on work already underway in response to COVID-19, and I welcome the range of engagement that informed the priorities within it. I am pleased that addressing CAM's waiting times will be prioritised and programmes such as distress brief interventions will be rolled out. In this Dementia Awareness Week, many of my constituents will welcome the commitment to ensure equitable access to mental health support for older people. I very much hope mental health will be at the centre of the NHS Recovery Plan set out in this motion today. Presiding Officer, public service is what I know, it's who I am, and over many years I have seen health and social care converge every day to make people's lives better. A national care service is a turning point in our commitment to social care as an investment for us, not a burden on us, offering the opportunity to deliver high-quality, accessible care designed around people's rights and needs. In conclusion, Presiding Officer, people in my constituency and across Scotland answered the call to action in the dark days of the pandemic. The Inchgarth COVID Support Project, Seafine Food Bank, Cove Woodland Trust and others all played their part in supporting mental well-being. I now give them my commitment that I will work as hard as I can across the Chamber and with the Cabinet Secretary to support the Scottish Government deliver the actions set out in both the Mental Health Recovery Plan and the ambitious NHS Recovery Plan at the heart of this motion today. Thank you.
Thank you very much, Ms Nicholl. I now call on Jackson Carla, who will be followed by Emma Roddick. Mr Carla.
Thank you very much, Deputy Presiding Officer. May I welcome you to your position. And can I begin by congratulating Audrey Nicholl on her debut speech. I look forward to hearing more from her as the Parliament progresses. There, of course, is an enormous challenge to deal with in relation to COVID recovery, both its own consequences and ongoing complications. We know of the backlog on cancer and mental health, and I hope to work as non-belligerently as possible with the Cabinet Secretary to resolve these issues, because we all understood that in postponing many of these things we were compounding a problem, but we should also recognise that there was a problem already there to compound, and that there is a huge challenge and task ahead of us. But one of those issues, and I referred to it when I welcomed the Cabinet Secretary to his position, is the future on development of MESH, because it too was partially and understandably postponed following the meeting that the First Minister had in November 2019 with MESH survivors. And I understand it's slightly peripheral in some ways to today's debate, so if I ask some specific questions, I hope maybe the Cabinet Secretary will contact me afterwards to update me on some of the points I might want to ask today. He is in fact the 5th Health Secretary in the 3rd Parliament to have to contemplate tackling the consequences of the worldwide MESH scandal. A wholly self-inflicted health crisis in countries everywhere, and in Scotland one amplified by the heroic efforts of some heroic women who brought this forward and allowed Scotland to become almost a beacon for people across the world in trying to advance the way in which we approach response to MESH. But let's remember, it cost lives, the first Eileen Baxter, and it ruined lives. And it therefore is fundamentally important that in this Parliament we resolve the issue finally. Firstly, can I ask the Cabinet Secretary about the case record review that was announced by his predecessor on the 10th of February? I did ask the First Minister at First Minister's Questions before Parliament ended if the terms were going to be amended as Professor Alison Britton was requesting, and I believe I understand that they have now been agreed. And I also asked and hoped that Dr Wael Agur, who has enormous confidence of many of the MESH women, be included in this process. And I'm delighted to say he's contacted me to say the Scottish Government have now invited him to work with Professor Britton. So both those things are welcome, but I'd be interested to know the timetable for the case record review now underway. Secondly, on the 24th of March, and to the absolute delight of the MESH survivors, his predecessor, Jim Freeman, announced that there would be a bill introduced, and I quote, as a priority early in the next session, which would offer retrospective payment and restitution to those women who have travelled out with the United Kingdom, principally to Dr Veronicas in the United States, for the costs associated with their operations. And I would very much welcome the Cabinet Secretary confirming when early in the next session he intends this bill to absolutely be introduced, because these women have waited long enough, they've suffered long enough, and I know that they are looking forward for this as quickly as possible. Thirdly, there is to be a consultation on the Patient Safety Commission, and I wonder if the Cabinet Secretary could confirm what the status of that is. And finally, can I say this? We now know that MESH extends way beyond a calamity for women. Women were organised and were able to bring this issue to the fore, but 10,000 hernia mesh operations using exactly the same materials take place in Scotland every year. They affect men, women and children. Some have died, some have suffered the same horrendous consequences. So finally, can I ask the Cabinet Secretary if he intends to ensure that there is a much wider review now of the use and application of MESH within the health service in order that we can draw an end to the scandal and the damage it is doing to thousands of our fellow Scots?
Thank you, Mr Carlo. Could I now call Emma Roddick to speak? She will be followed by Carol Mochan, and again the Chamber might wish to be aware that this is Emma Roddick's first speech.
Thank you, Deputy Presiding Officer.
You know, if you told me a few years ago that I would be working in Edinburgh this afternoon, I'd probably have been a bit upset because I would assume you meant that I had moved out of the Highlands. I certainly wouldn't have assumed that I would be in this place representing the biggest and best of our parliamentary regions. From Unst to Campbellton, Lewis to Keith, the scale of it is immense, and it is a true honour and a privilege to represent it. This fact overwhelms me every time I leave the region I now speak for to get the train down here, and again when I see the Keswick Bridge lights in the distance on my way home. I hope that thanks to our new virtual provisions, that journey won't always be necessary, and I might be able to attend this chamber from Skye or Sutherland or Shetland from time to time. I'm glad not to have to say any goodbyes to the person who held this seat for the SNP before myself, because Marie Todd has been returned as a constituency MSP and moved to the health brief, which I know she will be very excited about. I'm delighted to see that this brief includes specific responsibility for women's health, which comes with enormous opportunities, and I hope that during our health recovery she will take those opportunities to tackle shortcomings in the treatment and management of endometriosis, menopause, in trans healthcare and in access to abortion which is free of obstruction and harassment. I also look forward to working with Kevin Stewart in his new role as Minister for Mental Health, particularly at a time where the Scottish Government has announced a 25% increase in mental health spend. You can expect a good few emails from me. Usually, when you hear me speak about my region, I will be gushing about its beauty or its bakers or our broad accents. But one thing often hidden in the chat about the Straths and Glens is the looming mental health crisis that we face there. It's an issue across Scotland, but the three areas with the highest suicide rates in the country are in the Highlands and Islands. And that can be easy to miss amongst the many articles about how Inverness or Orkney are the most beautiful or happiest places to live. We can use that to brag to and bring in tourists, but that outlook is of no comfort to the people who are looking lonely out of their window at the scenery, considering whether or how to take their own life. I don't make a secret of the fact that I have mental health issues myself, and I strongly believe we need to get real about the things which are making people ill in the Highlands and Islands. Lack of transport, lack of affordable housing and jobs, lack of the right mental health services in the right places. Red deer and snow in the Ben can't cure depression, but isolation certainly fosters it. And at no time is that more important than when we think about those who've been unable to travel to their nearest neighbour over 5 miles away for much of the last year. Or when we think about those who lost the friends and family that they couldn't visit last Christmas and then didn't get the closure of a well-attended funeral and wake. The 18 million provided for mental health challenges created by the pandemic was very welcome, but even before COVID struck, 16.6 people per 100,000 in Scotland completed suicide in 2019. As we recover from one pandemic, we underestimate the magnitude of the other one at our own risk. Now, the enormity of the job facing me is about as large as the region itself, and that is not lost on me. I do love the Highlands and Islands, but I've also suffered a mental health illness in it. So I will spend the next 5 years doing everything in my power to improve the lives of others who make it their home, working with colleagues across this chamber to ensure we are getting it right. Thank you.
Thank you very much indeed, Ms Roddick. Could I now call on Carol Mochan to speak, and she will be followed by Emma Harper. And again, the Chamber will wish to be aware that this is Carol Mochan's first speech. Ms Mochan.
Thank you. Thank you, Presiding Officer. And before I begin my first speech, might I say what a privilege it is to be here speaking on behalf of my home region, south of Scotland. I fully intend to use my time here in Parliament to stand up for the ordinary people of this country and those communities so often ignored by a political class often distant from the lives of their constituents. I came here to get things done, and that is what the people of the south of Scotland elected me to do. So I think it is important we understand why so little has been done over the last decade before we move on to the next round of promises. There is no doubt the campaign we all just fought did not give as much attention to the desperate state of care, the NHS and mental health services as I would have liked. And as such, I welcome the fact a plan will eventually be brought here to the Chamber to deal with these matters. In this debate, I would particularly like to focus on the National Care Service and the concerning way in which carers are treated in this country. In care, the root of the problem is pay. There is no doubt this government is very accomplished at media management, presenting a progressive face to the public and promoting their own narrative. But if that story is not reflected in the pockets of care workers, some of the most overworked people in our country, then it is meaningless. We must also consider that this injustice disproportionately affects women, more often than not women who have never been blessed with the advantages of family wealth or a second additional income. When you take these factors into account, I have to ask, why has it taken so long for this to become a priority for this government? The pandemic may have highlighted this issue, but it should not have required such a life-defining event to turn our attentions to those who have been so undervalued for so long. The recent Feely report takes some important steps forward in tackling this issue, yet it failed to adequately address the chronic levels of low pay and poor terms and conditions experienced by most people working in care. I regularly speak to people of all ages and backgrounds, paid and unpaid, working every hour they can, caring for others, and the message is the same. We are struggling to keep our head above waters. It is time we started taking carers and a national care service seriously. But a national care service has to be worthy of the name and involve patients, carers, trade unions and local government from the outset. We can't keep building institutions from the top down and expect them to meet the needs of people at the bottom. Cabinet Secretary, rather than talking about the esteem a national care service will be held in, let's be clear about the financial commitment to it. Because if you want world-class public services, you have to pay for them. When Labour created the NHS, Britain led the world in socialised health. It was a complete shift in the lives of the whole country. I see no reason why we cannot aim for that sort of momentous change again. I hope that today is used as an opportunity for the Government to listen and take on board this genuine scepticism about any plans they have put forward to reform of health. Why? Because they have been in power for 14 years, and during that time we have seen the NHS becoming worryingly underfunded, understaffed, and as other colleagues have remarked upon, waiting times are now at concerningly high levels. Just this morning, I spoke to Sam H about the concerning waits for children and young people to CAM services, an ongoing issue that must seek urgent attention. In my final few seconds, though, I return to the issue of carers. I ask the Government to be honest with them. The latest Barnett consequentials provide Scotland with around £700 million for the health and social care budget. It seems sensible that the lion's share of that is spent on giving care staff a serious pay rise. I urge you to support Scottish Labour and the trade union movement's call for carers to receive £15 an hour. In my own region, that would make a vast difference to the lives of so many people. Let's achieve something meaningful straight out of the gate, right away, and let's send a message today from this new Parliament. Let's pay back those we owe so much. Thank you.
Thanks very much, Ms Mochan. I call Emma Harper, who will be followed by Dr Sanders Gulhani. Ms Harper.
Thank you, Deputy Presiding Officer. I welcome the opportunity to speak in this important debate on the health recovery, and I welcome the Cabinet Secretary and Mental Health Minister Kevin Stewart to their roles. The past 15 months has been an unprecedented time for us all, and the health and well-being, the social and financial challenges that have been experienced has been extremely difficult for many, including our healthcare workforce. Now that NHS Scotland has made rapid changes during the COVID pandemic, we do now have an opportunity to accelerate reform. And I thank everyone for their commitment and their work in the multidisciplinary team approaches so far. For this afternoon, I will focus my comments on 4 key points which have particular relevance to health reform in Dumfries and Galloway in the south west of Scotland, in my South Scotland region. These are cancer treatment pathways, travel reimbursement and the SNP's manifesto commitment for an agency for remote and rural medicine and the respiratory care action plan. Presiding Officer, I've raised D&G's NHS cancer treatment pathways previously on many occasions. And in D&G, it's part of South East Cancer Network, which is the SCAN network in Scotland. Current treatment pathways mean that patients in Wigtonshire and the rest of D&G who require, for example, radiotherapy as part of their treatment, they go to Edinburgh. They're referred to Edinburgh, which means a 260-mile round trip instead of going to Glasgow, which is a 150-mile round trip. Nowhere in D&G is in the south east of Scotland. The previous Cabinet Secretary said patients should be offered a choice for place of treatment. So I would ask if the Cabinet Secretary could provide assurances, whether it's later or in future correspondence, that patients are informed about their choice for place of treatment, including treatment closer to home. Additionally, persons in NHS and Dumfries and Galloway are only reimbursed for travel using a means-tested model, while alternatively, people in the Highlands and Islands and Ayrshire and Arran are eligible for full reimbursement for journeys over 30 miles and even overnight supported accommodation. I raised both of these issues, travel reimbursement and treatment pathway place, previously, and the former Health Secretary agreed for the Government to carry out a review. So I would ask whether this review has been completed and what changes for treatment pathways and reimbursement will be made as part of any health reform. My constituents in the west of Dumfries and Galloway will be very happy to hear about any positive steps to change current processes. Presiding Officer, good news is the SNP has a commitment for a centre of excellence for rural and remote medicine and health and social care. This aim is to provide expertise and advice on the delivery of care in different rural, island and remote settings across Scotland. I'd be grateful if the Cabinet Secretary could provide any further detail on how this rural centre of excellence will be taken forward. I have no doubt that a rural centre for medicine and the brand new fast-track cancer diagnosis centre, which is up and running in Dumfries, will undoubtedly help many people in the remote areas of Dumfries and Galloway with their health care issues. Presiding Officer, more good news is the commitment for the Respiratory Care Action Plan to be implemented, the RCAP. I was Lung Health Cross-Party Group convener in 2016 and not long out of my prior job as a nurse, and I called for a plan which could tackle issues relating to smoking, COPD and the very important issue of obstructive sleep apnoea, which is the first lung health issue which will be addressed in the RCAP. This is hugely welcome, particularly in dealing with long COVID, and I look forward to seeing how this is rolled out and implemented. And I welcome the Government's commitment on this and Dr Tom Farden and his team for taking this forward. In conclusion, Presiding Officer, I welcome this motion and debate today and the health recovery steps that have already been taken forward by the Scottish Government, and I look forward to positive engagement with the Cabinet Secretary in the future. Thank you.
Thanks very much, Ms Harper. I now call Dr Sandis Gulhani, who will be followed by Eleanor Witham. Dr Gulhani.
What would you do if your teenage daughter told you she was feeling low and upset? That she had cut herself to make the pain go away? That she has thoughts of not wanting to be here anymore? Unfortunately, these presentations are not isolated or rare. I hear these concerns all too frequently. This is a girl who has reached crisis, but she is in need of urgent help. But it is not a gradual process that patients go through to arrive at crisis. One does not simply happen upon crisis. We need to recognise these initial symptoms and act sooner to help. To do this, we need to spend the money allocated by the government wisely, and a children's wellbeing practitioner would be an astute step. These practitioners already exist in England, so we do not need to reinvent the wheel. They intervene with early signs of behavioural difficulties and self-esteem issues. They work with patients and parents and prevent our children from reaching crisis, which is needed, as latest figures show 2,000 kids in Scotland waiting a year for treatment. The NHS is under strain. In general practice, we have never worked harder, never seen such demand, never felt we were stretched so thin. Treating 50 patients a day, plus referrals, plus paperwork, plus results. We barely get time to eat lunch or go to the toilet. We work many more hours than we're supposed to. My colleagues across the NHS do the same, with hundreds of thousands of unpaid extra hours worked because we are dedicated to our patients. But we are burning out. We need every second we have allocated with each patient to give them the best care we can. So I would like an assurance from the Cabinet Secretary that he will guarantee that, as set out in the motion stating the Scottish Government will increase day case and outpatient activity by 10%, We will not achieve this by reducing the amount of time allocated for clinicians to see patients. In my maiden speech, I spoke about long COVID. Now, I'm not going to stand here and pick through the mismanagement of the pandemic, because to find fault is easy. To do better may be more difficult. But do better we must. Deputy Presiding Officer, for our country, for our health service, for these patients. Long COVID is a novel, multi-system disease that causes brain fog, depression, heart and lung issues, fatigue, being denied basic functions we all take for granted: to talk, to laugh, to breathe. It affects between 10 to 35% of everyone that contracts COVID, of everyone. We do not know how, we do not know why, we do not know how to treat it effectively. The UK government has provided new funding in England to set up COVID clinics. The Hertfordshire model is what I would like to recreate here in Scotland, to give us a multidisciplinary team of GPs, hospital doctors, physios, psychologists, OTs, dietitians, pain management teams, all working together and cooperatively to give these patients hope, something that has been lacking in their lives since falling victim to the COVID crisis. We want to improve and optimise recovery outcomes and reduce comorbidity. To do this, we need new funding to help tens, if not hundreds of thousands of patients. So I hope the Cabinet Secretary agrees with me that we need to commit new money to fund long COVID clinics. So, Cabinet Secretary, as in my referrals, I summarised my key points for clarity, and I thought that I would do this here. As you've said, your door is always open. After your speech, I see you recognise long COVID, but hope you agree with me that we need to provide new money to fund clinics here in Scotland, not add it to a burnt-out GP workforce that already has an unsustainable workload. We cannot cut the time clinicians have with patients to facilitate this 10% improvement. And can he assure me of this? And finally, I hope he agrees with me that to create a children's wellbeing practitioner would be a good step.
Thank you. I call Elena Whittam, please. Thank you.
Thank you, Deputy Presiding Officer. I may take this opportunity to welcome you to your new role. It is a huge honour and a privilege to be here in our Scottish Parliament representing the Gid folk of Carrick, Cumnock and Doon Valley, a wonderful constituency featuring some of the most beautiful rural and coastal scenery in Scotland, but also somewhere blessed with tight-knit communities who have tremendous spirit and ingenuity in the face of many challenges. This community spirit was certainly to the fore this past year as we all grappled with the reality of the pandemic, and my heartfelt thanks goes out to the tireless volunteers from the many social enterprises and community groups throughout the constituency who adapted and responded with hard graft to make sure that their fellow residents were fed and supported in the darkest of days. I also need to take a moment to thank my predecessor, the wonderful and tireless Jean Freeman. I share the feelings of our new Cabinet Secretary for Health as I seek to fill the big shoes that she's left behind with a wee bit of trepidation and a whole lot of awe. Thank you to my hard-working election agent Paul Cairns and the entire team who on election day dealt with a freak snowstorm in Muirkirk and a hailstorm like no other in Caitrin. I had hailstones down my boots for the rest of the day. And thank you to the thousands in Carrick, Cumnock and Doon Valley who ventured out to cast their votes. I take my responsibility as your representative here very seriously indeed, and I will work hard for you each and every single day. My whole working life has been one of seeking to address inequalities and champion social justice, including spending a decade as a women's aid worker. And for this reason, I was delighted to see that in her new ministerial team, the First Minister has included a Minister for Women's Health. Women and girls face significant barriers to good mental and physical health, and having a minister to take forward the already considerable work of the Women's Health Group and the Women's Health Plan, I'm confident that as a country we will finally see an end to women's health inequalities. For too many years, policy creation and research parameters have sidelined the well-being needs of women and girls. Many illnesses affect women significantly differently than men. For example, take heart conditions and strokes. They present themselves in an entirely different way in women, and yet many women, and indeed their own doctors, often miss the signs of serious illness which, left untreated, can be catastrophic. We also need to be aware of how intersectionality affects women's health inequalities. Women from Black and Asian minority ethnic groups, including Scotland's gypsy travellers, have a much higher incidence of maternal and neonatal deaths, and lesbian and bisexual women experience a much higher rate of breast cancer. And as I know from my work in life, domestic abuse is a high risk factor for depression, substance abuse and a whole host of physical disorders. For the many women I supported in refuge, they carried with them decades of unmet mental and physical health needs. Neurodiversity also presents itself in a very different way in young girls, and they often find themselves as grown women before somebody finally diagnoses their autism spectrum disorder or their ADHD. This can mean that the already fraught teenage years can become almost unbearable for girls who have no diagnosis nor the tools that they need to enable them to live their best lives. This is something that I have direct experience of, and I see firsthand how easily recognised signs and symptoms can be missed if we are always seeking to see the male version of a condition. Finally, I also welcome the creation of a new early cancer diagnostic centre in Ayrshire as part of our NHS Recovery plan, which is set to open imminently. We lost my mum at only 58 a few years ago to a late diagnosis of lung cancer. Like many women, she put her symptoms down to being tired due to her caring responsibilities for my gran who had dementia, and she put her worries to the back of her mind with devastating consequences. Like others who spoke before me, I must put on record my sincere thanks to the staff and staff nurses at Crosshouse Hospital who looked after her in those short few weeks. Deputy Presiding Officer, the pandemic has laid bare and shone a light on inequalities, and it is only right that our health recovery plan seeks to address them. And I look forward to seeing how our newly acquired East Ayrshire Community Hospital in my own constituency plays a valuable role in this. Thank you.
Thank you. I believe that was Ms Wishman's first speech to our Parliament today. And our last speaker in the open debate will be Sarah Boyack. Thank you.
Thank you, Presiding Officer, and welcome to your new post. I'd like to begin by recognising, as other colleagues have, the tireless work of our health and care staff, both before and during the pandemic, but especially now as we recover and we rebuild. So we need the Scottish Government to take on board the Labour amendment put forward by Jackie Baillie that calls for an immediate pay rise to £12 an hour for care workers, rising to £15 an hour over this term, but also effective engagement with NHS unions to ensure that all of our health and care professionals' work is rewarded and that they are supported with their vital contribution. I want to focus today on the crossover between health and social care and the need to ensure that no one who finds himself at crossover is missing out on the care, the treatment or the support they need. So I'm delighted with the fact that the Scottish Government will finally be pressing forward with Labour's National Care Service. From the outset, this service must be as fair to staff and users and accessible to people that need it. Last week, a constituent from Midlothian reached out to me for support. Her father has dementia, and as a family, they've been struggling to meet his care needs, particularly as his symptoms worsen. And as many who live with a dementia suffer, this has been a constant source of worry and concern, and it's been made worse by waiting lists for dementia beds and places in care homes and the absence of a social worker. And she told me that at times, because of his dementia, her father's behaviour has become incredibly challenging, even though he has antipsychotic medication, which means that when his symptoms are manageable, he's not his normal self, and the family feel like they're firefighting the symptoms, not treating the cause. And they were also advised that should he have a flare-up, they should call the police or to take him to A&E. A horrible solution to find yourself in, a situation to find yourself in, but not a solution. Now, thankfully, at the end of last week, after a long wait, they got a temporary respite place, and the family were appointed a social worker to support them through the next steps they need for long-term care. Now, they have praised everybody that supported them, but their experience shows the stress and the anxiety that exists in the crossover between health and social care, as well as the restraints on professionals trying to do their best. So as we move out from this pandemic, prioritising NHS recovery, building our national care service, we need to see that examples like the one I've described today are used to help design a better service, the best possible service for those receiving health and social care and their families and loved ones, so that no one falls through a gap. And we cannot go back to the delayed discharge crisis we had before the pandemic. So we need step-down care, accessible homes adapted to meet people's needs, and care staff treated with respect, with national terms and conditions, and our councils properly funded. That is essential in moving forward so that people get the support they need when they need it. Finally, I want to raise the issue that was a massive issue for us in Edinburgh before we had the election. And I call on the Cabinet Secretary. I hope that he will commit to fully funding a new eye hospital in Edinburgh, following the First Minister's promises during our election campaign. Yesterday, retired eye specialists raised their concerns that NHS Lothian could fail to back the plans that they had worked up with money that is paid for this from the Scottish Government to ensure a new eye hospital at Little France. As they said, Lothian's ophthalmic patients need a fully equipped and staff eye hospital to replace the crumbling eye pavilion, which is near the end of its useful life. We need a clear commitment and we need it fast. Thank you, Presiding Officer.
Thank you. And we will now move to closing speeches. And I first call on Gillian Mackay to close for the Greens. 4 minutes, please.
Thank you, Deputy Presiding Officer. Firstly, I'd like to give my congratulations to all of those making their first speeches today: Audrey Nicholl, Emma Roddick, Carol Mochan and Eleanor Whittam. It's a nerve-wracking thing, but I think you all did brilliantly, and the depth of talent and expertise in this session's new intake will certainly give some of our party colleagues a run for their money. The way we choose to remobilise our health service will be vital to ensure that we have a healthy population going forward. Our health service must always be in public hands and given the resources it needs. Primary care, including GP practices and community pharmacies, represents 90% of patient contact with the NHS and plays a central role in the health of the nation. Support must be directed here and at screening programmes quickly to ensure no one is missed. People should be supported to live the healthiest lives possible. Prevention and early intervention is key to achieving this, as is tackling the root cause of poor health, such as poverty, air pollution, poor access to food and other things such as smoking. Building a truly national health service is something that requires cross-portfolio working and a different approach to things than we've sometimes been used to. But we can do difficult things, and this is our opportunity in this building to start that hard work. Mental health has been repeatedly mentioned today, and I thank those who have shared their own experience of their mental health. CAMHS services are undoubtedly in crisis, waiting times for services are long, and we're trying to deal with complex needs, often through a set number of sessions of CBT. This isn't a service that's currently set up to give people the therapy and support they need. Many practitioners are seeing people being referred multiple times as the number of CBT sessions offered are not enough. The number of sessions offered often depend on a waiting list length and are very much subject to a postcode lottery. This needs addressed, and I look forward to working with the Cabinet Secretary and the Minister for Mental Health on this. Presiding Officer, we will be supporting the Labour amendment at decision time. We committed to supporting a £15 minimum wage for social care in our manifesto, and we did this because we know the critical role social care staff play, and we understand how demanding and skilled jobs in this sector are, and that they're predominantly done by women. We believe they should be remunerated accordingly. But we also understand this cannot be done as quickly as we would all like, and a broader debate needs to be had about the development of a transition to a national care service and how we pay for it. We will not be supporting the Conservative amendment, as the deletion of a commitment to the National Care Service is not something that we can support. We will also be supporting the motion. The Cabinet Secretary has laid out an ambitious plan within this motion, and my aim is to robustly hold him to account and, where I can, push him further to do everything we can to support Scotland's health and wellbeing bounce back from this pandemic. Thank you.
Thank you. I now call on Paul O'Kane to wind up for Labour, and this is Mr O'Kane's first speech to the Parliament.
Thank you, Deputy Presiding Officer, and may I begin by welcoming you to your role. It is an honour to be able to make my first speech in this chamber and to close for Scottish Labour in this important debate on our health recovery. Like others have done, may I begin by welcoming the Cabinet Secretary and the ministerial team of Marie Todd and Kevin Stewart to their roles, along indeed with all our new shadow spokespeople across the chamber. This is a time like no other, and collectively we must rise to the challenges that lie before us. There will, of course, be times when we disagree, but there is also much common cause as we support our NHS to recover and we build the social care services we need for the future. May I also commend colleagues across the chamber who have made first speeches today. I think we have begun to see the breadth and depth of what the 2021 intake will bring to our debates in this place, and I do hope that my own contribution this afternoon will continue in that vein. Presiding Officer, I hope that the Chamber will indulge me for a moment, as is the custom, whilst I thank my family, especially my parents and my brother, my friends, party activists and everyone who has believed in me and supported me to be elected to this place. I have to make a particular mention for my partner Alan, whom, COVID permitting, and 1 year late in August will be my husband. Colleagues can expect some questions from me on the regulations covering weddings, and I hope that they will forgive me for that particular declaration of interest. It's an honour to represent West Scotland and the communities where I grew up and still live today, and the communities that have shaped me, from Neilston and Barrhead to Kirkintilloch and Port Glasgow. And I want to take a moment just to pay tribute to those retiring members from West Scotland who have served with distinction over many years. To Mary Fee, particularly for her sterling work on equalities and human rights. Mary's work for the rights of Gypsy travellers in Scotland is something I believe we should all take inspiration from as we move forward with a recovery that works for everyone. To Ken McIntosh, so much has been said about Ken already, but Ken is a great friend of mine and someone who has always encouraged me ever since I first delivered leaflets for him, as Jackson Carla will attest to in my early teens. It was a great joy to be sworn in by Ken 3 weeks ago, or 4 weeks ago now, and he served our Parliament, our communities in Eastwood and West Scotland, and indeed our country, I think, with diligence, integrity and kindness, something that can be all too lacking from our politics at times. Upon my election to this place, I remarked that when I was growing up, there were times that I was worried that I wouldn't be accepted for who I was, that life would always be hard, and that discrimination and hurtful words would just be something that I had to accept. But there are two great things that gave me cause for hope as a teenager. The first was exceptional teachers at my high school, St Luke's in Barrhead, who saw me for who I was, who genuinely cared, and who always taught me to be myself, my best self. In many ways, like countless other educators, they understood the real importance of supporting the mental health and well-being of young people, long before perhaps we'd started to meaningfully discuss the far-reaching impact of poor mental health for children and young people across Scotland. And the second was this place, our Scottish Parliament. On the cusp of becoming a teenager and realising that I was gay, the battles around the repeal of Section 28 raged across our society. On our television sets and through our letterboxes came the message that there was something inherently wrong and dangerous about LGBT people, and that pretended family relationships had no place in our schools. I heard the anger, the hate and the downright mistruths that were told about people like me, and I was terrified. And then people stood up in our new Scottish Parliament and said aloud that the new Scotland, in the fledgling days of devolution, would be a place where inclusion, respect and equality were the hallmarks. People like Wendy Alexander and Donald Dewar, and of course, my now colleague on these benches, Jackie Baillie. That is the power of this Parliament, the power to choose, the power to make things right, the power to say to teenagers like me, you have a place, you belong, you will be safe, and we will stand up for you, for all of your hopes, your dreams and ambitions. As Dewar put it, more than our politics and our laws, who we are, how we carry ourselves. This debate today, the long discourse we will have about recovery from the pandemic, must be about who we are and how we carry ourselves. Over 10,000 of our fellow citizens have lost their lives in the pandemic. And whilst we have heard that figure often in this chamber, each represents a person who loved and was loved. And again, our condolences are with anyone who has lost someone. Presiding Officer, we must ask ourselves how will we help carry those who are left behind? Those who were already struggling with physical health conditions or poor mental health before the pandemic. The 10,618 waiting over 18 weeks for mental health services. The 1 in 5 young people still being rejected from CAM services. The 28,000 people who have waited over a year for treatment or surgery. The missing cancer diagnosis. the more than 100,000 people waiting anxiously for a diagnostic test, the social care workers, overworked and feeling undervalued, these COVID heroes whom we all applauded each Thursday night, but who were only offered a 20p uplift from this government. They deserve an immediate pay rise of at least £12 an hour, rising to £15 per hour in this current Parliament. That is something we will work across this chamber to secure, with anyone who shares our view and the views of our trades unions, that after the applause has fallen silent, there must be meaningful action to support our care workers. It is clear, Presiding Officer, that an NHS recovery plan is urgently needed, but we will press the Government to ensure that those anxiously awaiting diagnosis and treatment, those who so badly need mental health support, and those workers who gave their all throughout the pandemic are not forgotten. We will use the power of this place to choose, and we will be by their side. Thank you.
Thank you. I now call on Craig Hoy to wind up for the Conservatives, up to 7 minutes, and this is Mr Hoy's first speech to our Parliament today.
Thank you, Deputy Presiding Officer. And can I begin by congratulating you on your new role and by welcoming the Cabinet Secretary and his colleagues to their new positions. This afternoon we have heard powerful speeches, particularly from new members, but also members on all sides of this chamber. Paul O'Kane, who spoke passionately about the challenges of growing up gay. The Cabinet Secretary, who talked about the daunting role that lies ahead of him, and a role that we wish him well as he commences. Emma Roddick, who spoke with passion about the challenge of mental health, including her own challenges. And my colleague Dr Sandesh Gulhani, who talked movingly and with first-hand experience about the long COVID challenge that lies ahead in our NHS. And Jackie Bailey, who set out the stark realities of the mental health challenge and the challenge facing our cancer care services. Jackson Carlaw, who rightly set out how we must resolve the mesh scandal during this Parliament through a process of restitution. And of course my colleague Annie Wells, who noted the progress made against COVID, who thanked our dedicated NHS staff and who warned that there are significant challenges ahead. And can I also thank those new members who have made their maiden contributions: Audrey Nicholl, Carol Mockin, Gillian Mackay and Elena Whittam, who talked with conviction about women's health issues. As a former journalist, I have listened to many maiden speeches, but today is my opportunity to make my first contribution in this Parliament. And I would like to start by paying tribute to Ian Gray. After his final speech here, I wrote to Ian thanking him for his service to East Lothian, and I said that his successor would have very big shoes to fill. Little did I know that it would take 3 MSPs, Paul McLennan as the constituency member and Martin Whitfield and myself as the regional MSPs, to fill Ian's shoes. It is an honour to be able to represent the south of Scotland. I live in East Lothian, I grew up in Mid Lothian, and my late Granny Hoy was brought up in the Law near Carluke in South Lanarkshire. So the threads of my own family run through the rich and diverse tapestry that is the south of Scotland region. It was there in the Law village where my great-aunt Jenny lived with her brother and sister in a cold, cramped miner's cottage that I first saw political debate. For Jenny was something rare in South Lanarkshire in the early 1980s. She was a Conservative, or in the words of her sister Flora, she was a bloody Tory. But Jenny wasn't that at all. She was what hundreds of thousands of working-class Scots went on to become. People who are ambitious for their families, their friends and their communities. People who stood apart from the old Scottish Labour ways. People who rejected a benign and no doubt well-intentioned socialism, which sadly kept the poor and the working classes in their place. And while many families, including my own, moved on and made progress, others did not. Poverty and the harsh health inequalities it causes is a stubborn stain on the character of modern Scotland. And 60 years after deindustrialisation, we still have a chance to break this cycle. 4 generations with no hope, no stake in society that they see around them. many living with chronic health conditions, others with the misery of drug and alcohol misuse, and before COVID, record numbers confronting mental health challenges. Their life choices limited, their life chances blighted, and their life expectancy blunted. Poverty and poor health are the result of public policy failures by a succession of administrations. My own party, Labour, and now 14 years of SNP government in Scotland. So, as we did debate the health recovery, let's not kid ourselves that everything was in a good place under the SNP before the pandemic. The worst rate of drug deaths in the Western world. And we found out today that 2,000 children and young people are waiting over a year to begin vital mental health treatment. And even before COVID, the SNP's waiting time improvement plan was in chaos. In the election, we were clear about the urgency of the health challenge, and I welcome Minister's commitment to an NHS recovery plan. In March, 100,000 Scots were waiting on key diagnostic tests. The cost of misdiagnosis and cancelled operations will be with us for decades. And that's why we called for guaranteed increases in NHS funding for every year of this Parliament. An additional £600 million to tackle the NHS treatment backlog. Outpatient appointments and elective surgery 7 days a week. These are practical proposals to help remobilise our NHS today, not in 100 days. In relation to today's debate, members will note our amendment to the government motion, and I hope that they will give it their consideration and support. But before I conclude, I want to turn to a myth which sadly could dominate this term. That is that this Parliament needs more powers and that Scotland needs to split from the UK to achieve a lasting COVID recovery. The powers to remobilise and revitalise our NHS are already vested in this institution. The levers which control those powers sit there just in front of ministers on that front bench. But that said, let me give the following reassurance on our health recovery. Where ministers reach out and use those powers to full effect and good effect, they can expect the full support of this party in this Parliament for those endeavours. The success of the UK vaccine programme means that the long shadow cast by COVID could now be starting to fade. But no one in this chamber, or in our GP surgeries, or on our hospital wards, should underestimate the scale of the challenge ahead. The Scottish people want an NHS that they can be even more proud of, and we must work as hard as our frontline NHS staff to deliver this. If we work through our political differences, then in 5 years' time, we will be able to look our constituents in the eye and say that we did our best for them. And that, I believe, is all they ask and all they expect from us. Thank you, Deputy Presiding Officer.
Thank you. And I now call on Kevin Stewart to wind up for the Scottish Government. About 9 minutes, Minister. Thank you.
Thank you, Presiding Officer, and can I welcome you to your new role? I'm sure you'll be fantastic in it. I'd like to thank everyone today for their valuable and often personal contributions that have made this extremely important debate even better, I think. I'd like to pay tribute to Audrey Nicholl, to Emma Roddick, to Carol Mochan, Eleanor Whittam, Paul O'Kane and Craig Hoy for their first speeches. And apologies to the old hands today, but I'm going to mainly concentrate on their contributions and all of the aspects of my portfolio in my closing remarks. We have ambitious plans on mental well-being and social care as a core. Improving quality across both offers will be a vital part of our recovery. The health and well-being of individuals and communities at this time is an absolute priority, as many have mentioned in their speeches here today. Recovery in the social sector will only be achieved if we learn the lessons from the pandemic. We must recognise the challenging position that many employers and workers are now facing and we must seek to improve the offer, services and outcomes to give all recipients the best opportunity to thrive in the future. Now, many folk have talked about lived experience and their own personal experiences today. And I don't think that we should be afraid to talk about our personal experiences in this place. And we should not be afraid to listen to those folks with lived experience as we formulate the policy for the future. And I fully intend to ensure that we engage everyone that we possibly can in formulating the mental health and social care policies that we need to do. That is the only way that we are going to improve the offer. There has been significant media focus on mental well-being over the last year. And it's important that we recognise that moving forward, there will be a broad range of areas where mental health and well-being in itself may have an impact on our recovery if we don't get things absolutely right. As Mr Yousaf explained, we are committed to the creation of a national care service, backed by an increase of 25% in investment in social care over the term of this Parliament. We will build a world-leading social care system, one which will be based on fairness, equality and human rights. And it will provide us with the consistency, the equity, the fairness, the national approach and accountabilities we need to improve social care here in Scotland. And in the first 100 days of this administration, we will begin consultation on the legislation required to formulate the National Care Service. And I want as many folk as possible to respond to that consultation. I want you as MSPs to be evangelists, to get folk to respond to that consultation so that we have as many people as possible having their say. The aim is to have that legislation introduced into Parliament in its first year. This will not be easy, and we will need to think radically. And this work will be supported by the Social Covenant Steering Group, which will include those with actual lived experience of using care services. The National Care Service will be operational within the 5-year lifetime of this Parliament, but we have a lot of work to do. I certainly will give way to Ms Duncan Glancy.
Pam Duncan Glancy.
Thank you, and I thank you for taking this intervention, particularly at the late stage in the discussion. Given the very welcome statement that care staff should have parity with health staff, can you outline the mechanisms that you will use to make the £500 payments to the care staff who have yet to receive these, and mainly who are employed through direct payments or ILF and in the third sector, and when they can expect to receive this money?
Minister.
Ms Duncan Glancy makes a very good point, and obviously she will recognise that it was one of the things that was lying on my desk when I first took office. We are doing everything possible to make sure that those payments reach people that should have had them as soon as possible. I've written to the local authorities, to health and social care partnerships already on this issue, and we will do all that we can to make sure that that £500 is in their pooches and purses as soon as possible. And I'm sure Ms Duncan Glancy will continue to ask me about that as we move forward. Presiding Officer, I think there are a number of other things which have not been particularly brought up during the course of this debate, but I think that I must touch upon because they have been areas where members of the public have contacted me and I know others, particularly on care home visiting. On care home visiting, I have to say it is my priority to meet with representatives from across the sector to support further progress and improve the quality of visits. I've also written to the Care Inspectorate today to ensure that care homes are following the guidance that we have put in place. And we are committed to strengthening residents' rights in adult residential settings. And this includes working quickly to give effect to Anne's Law, where residents can access their nominated relatives or friends to support their well-being. And delayed discharge has also featured sparingly today. And I'm very well aware of the human cost of delayed discharge and the benefits of ensuring that we address this properly. And I will work with all health and social care partnerships to ensure that this is addressed safely and lawfully, and I have also written to them to this effect. Mental health is an absolute priority for this government. I will, very briefly.
Martin Whitfield.
Been mentioned today, and I wonder whether you could comment on the state of dental affairs here in Scotland, which appears to be in a great crisis, both as a result of COVID, but before that as well. I'm grateful.
Minister, there's time in hand to give you some time back.
I have to say that dental services have improved dramatically over the last number of years. If you take the north east of Scotland, my own area, folk queued for miles, literally, to get on an NHS dentist's books. That's not the case anymore because we invested in the dental school in the north east. And in our manifesto, the SNP has committed to remove dental charges to ensure equity in the field of patients and dental needs. So I think we will provide Mr Whitfield with a greater response, but I think we have made a huge advance there. But mental health is an absolute priority for this government, and it has been throughout this pandemic. Our mental health transition and recovery plan outlines our response to the mental health effects of COVID-19, containing over 100 actions. And we're particularly focused on providing the right help and support to anyone whose mental health has been disproportionately affected over the past 15 months. And that plan is supported by a £120 million recovery and renewal fund to transform services. And that's the single biggest investment in mental health in the history of this Parliament. Today, we have the statistics that there are more folk working in our NHS than ever before, some 9,000 more. And we have 80% more folk working in child and adolescent mental health services since we came to power in 2007. But we have a way to go. And we have agreed early priorities for the investment that I've talked about earlier, and have allocated over £34 million to deliver transformational improvements to CAM services and to clear waiting lists, backlogs for both CAMs and psychological therapies. I think we have all seen the quarterly statistics published this morning. And I have to say that some board areas are performing much better than others. I want to ensure the export of best practice so we can get the improvements that we need in CAMs. And I've already started engaging with board chief executives at both ends of the performance spectrum, and will continue to do so across all boards. I think it is absolutely vital that we get this right for our young people. Presiding Officer, I'd like to thank you and everyone for taking part in this debate. The pandemic is far from over, and there is much to be done to support the mental health and social care sectors in their recovery. Our recovery plans must be robust, and they must have people at the centre of them. People who work in the social care and mental health sectors, and people in the community who require their services. As we move forward, we need to continue to listen, and I'm a great believer in ensuring that those with lived experience help formulate policy. As Minister for Mental Wellbeing and Social Care, I am committed, along with my ministerial colleagues, to doing just that. Thank you, Presiding Officer.
Thank you, Minister. And that concludes the debate on health recovery. We'll have a short pause before we move on to the next item of business. Thank you.
Thank you. The next item of business is an urgent question, and I call Jamie Green.
Thank you, Presiding Officer. To ask the Scottish Government for its response to the Scottish Law Commission's discussion paper on the mental element in homicide and the wider implications it has in ending the so-called rough sex defence.
Cabinet Secretary Keith Brown.
Can I thank Jamie Green for his question and also for the constructive discussion we had once he'd been appointed to his post, and also welcome him to the role of Justice Spokesperson for the Scottish Conservatives. We are very pleased that the Scottish Law Commission has published their extensive discussion paper on reforms to homicide law. The Scottish Government asked the Scottish Law Commission to undertake this project in light of various court judgments which recommended a fundamental study into homicide law, and so it's positive to see that this progress has been made by the Commission. In line with the normal processes for Law Commission reports, we await the Commission's final report, which will be developed and informed by the responses to their initial discussion paper. I don't want, obviously, to preempt the final recommendations of the Commission, but I do very much welcome their inclusion of certain aspects of homicide law for consideration for reform. This includes the Commission looking at whether Scots law needs to be made clearer in terms of the rough sex defence, so-called, whether new defences in respect of those who experience domestic abuse are needed, and the consideration of reforming the defence of provocation in this area of law. It's of course right that Parliament will have the opportunity to consider the Commission's final recommendations on these matters when they report.
Jamie Green.
Can I thank the Cabinet Secretary for his response and welcome him to his new role in the challenging of times. But this much-needed discussion paper effectively opens the door for the potential of changes to the law in the most serious of crimes, namely of murder and culpable homicide. The Chair of the Scottish Law Commission, Lady Patton, said that she hopes that this paper will ascertain if current Scots law is truly fit for purpose in the modern era. This is a modern era which has shone a spotlight on violence against women, on coercive behaviour, and redefining how a case for defence is made by those who have suffered at the hands of abuse. Can I ask the Cabinet Secretary, given that his predecessor, sitting a few feet away from him, previously said that it was only a perception that the defence of rough sex still exists in Scots law, if responses to the paper make it clear that it is the law itself which is deficient, not perceptions of it, will the Government commit to legislative change in this area?
Cabinet Secretary.
Can I thank Jamie Green for his supplementary question? I think that is the purpose of this report, so that we can look at what comes back from the Scottish Law Commission, not just in its interim report, but in its final report, when it's had submissions and consultation responses, including indeed from anybody in this Parliament which wants to respond. I think there is an acknowledgement that there needs to be, and that's the purpose of the report, an updating of some of the defences for homicide and murder. There's no doubt about that. And to take into account some of the points that Jamie Green makes about gender-based violence, some of the language, some of the notions that are used. So I understand and accept that point. There is some confusion over the rough sex defence, whether it is actually a defence in terms of a crime that's been committed, or whether it can be used not in mitigation, but certainly to reduce the charge which is made by making sure that the murder charge is not made out, if you like. And also it can be used subsequent to a finding, a guilty finding, in order to inform sentencing. And I think it's very important that we have clarity on that, which is one of the things which this report seeks to do. And I would hope that be welcomed not just by Jamie Green, but by everybody else that's interested.
Jamie Green.
I do agree with the Cabinet Secretary in the sense that there can never be any defence for gender-based sexual violence. That's something this Chamber would commit to agreeing on. But the SNP manifesto ahead of the election did promise and indeed committed to a reformed justice system. The problem is, Presiding Officers, that we have an enormous backlog in our courts right now. There are nearly 38,000 cases, and the forecast currently is that we won't clear that for at least 4 years. The effects and the trauma of these lengthy waiting times are clear to the victims and to their families. So let me ask, what urgent action has been taken by the Government right now to clear this backlog? And will this reformed justice system finally put the needs and the rights of victims at the heart of it?
Cabinet Secretary.
Well, Jamie Green will know a number of the actions already taken, both by my predecessor and the Scottish Government previously, for example, the £50 million to help deal with that backlog, the unusual citing of additional cases that have been taken through the system just now. He is right to say, of course, there's a backlog, a significant one. There is one, I think, in every developed country in the world in terms of backlog, in terms of the courts. However, going back to the point he first raised about this particular report, it is important, and he's right to say there's a need for reform here, that it's taken together. That's why the Scottish Law Commission have taken a number of different aspects of the justice system and put those together, because if you uproot one part of it, you can cause unintended consequences elsewhere. So I think it's very important that they've done this comprehensive review, that it's now subject to consultation, and that everybody who is interested has the chance now to make their views heard. And of course, we want to do that in a way that when we can make progress, as we are doing with the backlog, we can do that in as fair a way as possible, and taking into account the much better appreciation there is these days for the gender violence within the justice system for women and girls.
Thank you. I have a number of supplementaries. Can I ask members who are interested in asking a supplementary to please press the request to speak button? And can I call Pauline McNeill to be followed by Emma Roddick?
Does the Cabinet Secretary agree that consent to sex can never be a defence to murder or serious sexual assault? The We Can't Consent campaign noted that there were 60 cases across the UK where the so-called rough sex defence was used, and that 40% of women under 40 reported being violently assaulted during sex. Does the Cabinet Secretary agree that it is in fact time to remove the partial defence of provocation by sexual infidelity from our law books, to show that when it comes to the law, our law seeks to keep women safe?
Cabinet Secretary.
I would, in general principles, agree with what Pauline McNeill says. There are different things which she's mentioned there. She's mentioned consent, and she's also mentioned provocation, which can be applied in different ways. But I think you're absolutely right to say that consent cannot be used if you're harming somebody in that way. Somebody's consent, the old principle, I think it was called the volante, that you volunteer to have that harm done to yourself, is no defence. And I think we have to make sure that the reforms that we carry out to the legal process reflect that. Yes, there's no question it has been used by some people in the past. I think the courts have exercised very keen fairness, if you like, and decision-making powers in relation to whether they see that as acceptable. But I do expect, and I hope, that the thrust of this report, not just in this one area that we're discussing just now, but throughout it, will lead to an updating in very many important respects of the legal process in this area, and I hope that will be supported by the Labour Party as well.
I call Emma Roddick.
The Cabinet Secretary will be aware that a person who kills in a jealous rage brought on by the belief that they have been cheated on can escape a murder conviction under the law as it stands. Does the Cabinet Secretary believe that, regardless of the ultimate conclusions on the more technical aspects contained within the discussion paper, the partial defence of provocation by sexual infidelity has no place within modern Scots criminal law?
Cabinet Secretary.
Can I thank Emma Roddick for her question? I'm not sure if this is the first time she's spoken in the Chamber, but can I welcome her to her place as well in the Chamber, and point out, of course, that some of the points that she raised are similar to the ones that Pauline McNeill has just raised. It's a very important issue. I do hope that members will understand that the Law Commission will prepare this final report with recommendations and deliver that to ministers, and I don't want to preempt that consideration when the final report is provided. But I do, however, think there is a compelling case for serious consideration to be given in this specific area of reform, and I look forward to seeing what people have to say in response to the discussion paper. I think that it's very likely that many people will hold the views expressed by Emma Roddick before the Commission make their recommendations for reform.
And I call Russell Finlay.
Thank you, Presiding Officer. The so-called rough sex defence isn't the only issue in our justice system to impact women who have been the victims of sexual violence. I'm of course talking about the not proven verdict, which was returned in 20% of all acquittal verdicts in Scotland in 2019-20. But in rape and attempted rape cases, the figure was 44%. Behind these numbers are real people who suffer additional trauma from a verdict which serves no useful purpose. For the sake of future victims, surely not proven must be scrapped without any further delay.
Cabinet Secretary.
I'm not sure that was a question rather than a statement, but I would say that, of course, the SNP's manifesto committed to look at this area. I think it's also true that it's linked fundamentally with other potential reforms of the justice system, some of which I think it may well be that the member would support. So I think it's important it's taken forward in a considered way. It's right that time is taken to get these things right. I understand entirely and don't disagree with the points that the member makes about the way this is badly served women in particular in relation to this. But I do think it's important we take it forward in a considered way. And to that end, I would repeat my invitation to any members, whether it's a justice spokesperson for the Scottish Conservatives, the member himself or any others that want to contribute to this process. We're more than willing to listen to the points that are made.
Thank you. I call Emma Harper.
Thank you, Presiding Officer. For me, I want to be clear and help protect anyone against any sexual violence. But just to be clear, Cabinet Secretary, in Scots law, there is no so-called rough sex defence. The doctrine of valenti was excluded by the celebrated case Smart versus HMA in 1975. The square go case, meaning that in Scotland, to claim any victim consented to the act resulting in their injury or death is not a defence in itself to crimes of assault to injury, culpable homicide or murder. So does the Cabinet Secretary therefore agree with me that while there is still more to be done to protect against sexual violence, our law in Scotland does not allow for the so-called rough sex defence?
Cabinet Secretary.
Can I thank Emma Harper for her question? It is the first time I've heard reference to the square go defence in terms of law, but it's a very important point, and it's similar again to the one that both Pauline McNeill and Emma Roddick have raised. An accused person cannot claim that a person consented to the harm caused to them, and so it's right to say there is no, if you like, legitimate rough sex defence. However, it's also true to say an accused person may seek to portray events in such a way to reduce the charge, as I mentioned, from murder to culpable homicide. That's for the court to determine in a given case, and I am pleased again that the Commission is looking at this area to see if steps are needed to make the law clearer in this regard, and I will consider carefully the recommendations. But I do agree with Emma Harper that it's important to be clear what is being talked about when discussing the rough sex defence.
And Claire Baker.
Thank you very much, Presiding Officer. I have previously asked the Scottish Government about the recording of data in cases which involve violence during what began as consensual sexual activity. The then Justice Secretary confirmed that the police and the court do not provide information on such cases, but said that discussions would take place with stakeholders about how this data could be extracted. Can the Cabinet Secretary provide any update on related discussions and on any work that is going to be taking place to ensure that data in such cases is recorded so that we can better understand the extent of the issue?
Cabinet Secretary.
I'm more than happy to provide that update to the member in writing, but I would say, given the discussion that we've just had and the reforms which are being proposed and the Law Commission's report, this area is going to be subject to substantially more scrutiny, and I think the fact that it should be based on relevant and up-to-date data is very important. So I'm more than happy to respond to where we are just now, and also to give some indication of where we intend to go in future with the collection of such data.
And finally, James Dornan.
Thank you, Presiding Officer. I have long campaigned for the elimination of violence against women and girls, and the Cabinet Secretary will be aware of the campaigns led by my incredibly brave, determined and focused constituent, Fiona Druitt. It's clearly vitally important that we do, and are seen to do all we can to ensure justice is done for all victims of domestic abuse. But can the Cabinet Secretary advise whether the Scottish Government will commit to undertaking research in the future, and whether the changes made in England have had any effect in practice?
Cabinet Secretary.
Can I thank James Donnan for his question, and also with him commend Fiona Druitt and the Emily Test, the works that are tirelessly taken to support effective gender-based violence interventions in colleges and universities. And I would commend his constituent Fiona on all her efforts, in particular those which are focused on improving students' well-being and ensuring that victims of abuse do not blame themselves for crimes committed against them. I'm aware of the work that she has done in further and higher education institutions. In respect of the changes in law in England and Wales, whereby the previous common law was placed on statute, the effect is now a matter of statute that a person can't claim a so-called rough sex defence, whereas previously it was a common law practice. As the UK Government, though, has acknowledged, this was not a new law, but, as I've said, something that was made clear in statute for the first time. And for that reason, the new statute law is not yet in force. It was only recently passed. But I do commit to answer the member's question directly to engaging with the UK Government to understand what plans they might have to monitor and evaluate the effect of the new law.
Thank you. That concludes that item of business, and the next item of business is consideration of Business Motion 00196 in the name of George Adam on behalf of the Parliamentary Bureau, setting out a revised business programme for this week. And I call on George Adam to move the motion.
Thank you, Presiding Officer, and moved.
No member has asked to speak on the motion. And I therefore call the question is that the motion be agreed. Are we all agreed? The motion is therefore agreed, and there are 3 questions to be put as a result of today's business. The first question is that Amendment 144.4 in the name of Annie Wells, which seeks to amend Motion 144 in the name of Humza Yousaf on health recovery, be agreed. Are we all agreed? Yes. Okay. Parliament is not agreed. Therefore, we will move to a vote. And we will suspend for a technical break. Thank you, colleagues. The Parliament is not agreed. Therefore, we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on amendment number 144.4 in the name of Annie Wells is yes 32, no 68. There were 22 abstentions and the amendment is therefore agreed. My apologies, not agreed. Oops. The next question is that amendment 144.1 in the name of Jackie Bailey, which seeks to amend motion 144 in the name of Humza Yousaf on health recovery, be agreed. Are we all agreed? No. Okay, the Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on amendment number 144.1 in the name of Jackie Bailey is yes 29, no 89. There were 4 abstentions and the amendment is therefore not agreed. The final question is that motion 144 in the name of Humza Yousaf on health recovery be agreed. Are we all agreed? Parliament is not agreed, therefore we'll move to a vote and members should cast their votes now. The vote is now closed. Thank you. The result of the vote on motion 144 in the name of Humza Yousaf is yes 90, no 32. The motion is therefore agreed. That concludes decision time and I close this meeting.
How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That desire for independence
is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a balanced stone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
The work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.